Good morning, everyone. This is Caleb Cage. I'd like to call to order the November 12th, 2020 meeting of the COVID-19 Mitigation and Management Task Force. We'll start agenda item number 1. And Megan, if you could please call the roll.
Caleb Cage.
Here.
Richard Whitley.
Here.
Terry Reynolds. Jamie Black.
Here.
Dave Fogerson.
Present.
Felicia Gonzalez. Brett Compton.
Present.
Megan Moore-Franson. Here. Chris Lake.
Here.
Dagny Stapleton. Wesley Harper. Mark Pandori.
Here.
Tyra Morgan.
Here.
Lisa Sherrick.
Here.
Julia Peak.
Here.
Melissa Peak Pullet.
Here.
Linda Feather.
Here.
Leslie Mollenkamp.
Here.
And for the record, Samantha Laddick.
Here.
Megan, this is Terry Reynolds. I was on mute, so I'm here.
I'll mark that for the record. Chair, you do have a quorum.
And Dagny Stapleton here too. Thank you.
I'll mark that as well.
Thank you, Dagny and Terry. Caleb Cage for the record. Appreciate that. We will continue on with the agenda. Very busy and full agenda we have today. However, I'd like to go to public comment, agenda item number 2 at this time. Just a reminder that no action may be taken upon a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action may be taken. Public comment may be limited to 2 minutes per person at the discretion of the chair. Comments will not be restricted based on viewpoint. If you are calling in to provide public comment at this time, we remind you once again to use *6 to unmute yourself and then *6 to mute yourself again. At this time, we will open the floor to public comment. Will the first person providing public comment please identify yourself and begin your public comment?
Chair, this is Randy Brums for the record. If I can, just remind anybody calling in to state public comment to dial *6 to unmute their phones.
Thank you, Randy. Because we are working remotely right now and we're using a technology solution that has worked for us in the past, I want to make sure we leave public comment open for just a little bit longer to make sure that nobody is trying to call in and provide comment. However, I know that we did have some public comment that was provided via email or regular mail, and I would like to have Megan read those. Megan, I will be timing you for 2 minutes each, as we would with any public commenter at this time. If you would go ahead, state the name of the commenter, and please begin reading.
First public comment is from Debbie DeVal. She writes, "Dear Task Force, thank you for your concern and care about the health of Nevada citizens. As you are aware, your plans to move forward with your COVID-19 mitigation and management of our state, please consider this. Now that many months have passed and more information has been collected regarding COVID-19 and testing, it has been revealed by Dr. Anthony Fauci and in various research and articles, including New York Times article, that PCR or amplification testing produces false positives when cycled more than 35 times. From what I understand, the labs Nevada used for COVID testing are using a cycle threshold of 40 to 45. A quote from Dr. Fauci says about 35 cycles, this is the only way to detect dead nucleotides. Could this be why there are so many cases right now? Nevada citizens deserve accurate testing results. Thank you." The next public comment is provided by Nancy Jones. Please let me know how Nevadans can have actual conversations with members of this task force and receive responses to our queries and concerns rather than simply reading a statement to the committee so the committee can ignore. The PCR tests that are being used by labs across the state of Nevada are using too many cycle thresholds to amplify the SARS-CoV-2 virus. According to the CDC, asymptomatic people shouldn't be tested at all. For symptomatic people who are tested using a PCR test, the cycle threshold should be lower than 30 to 35 because anything higher than that only discovers fragments of viral DNA incapable of being cultured and thus not infectious. Persons who have a positive test at cycle threshold levels higher than 35 should not be considered sick, infectious, or a threat to anyone. Please demand that across the state, labs lower cycle thresholds so that cases reported can be a meaningful number, and make sure that labs are communicating this information to the individual and including the cycle threshold level used in making that determination of whether that person is a positive for this virus. Please remember that no person on this committee is elected to represent the people of Nevada, nor to be legislators creating new laws or demanding compliance. Your role is simply to get the best, most transparent information to the people of Nevada and let them make their own health decisions and risk assessments. Next public comment is provided by Paul McClintock. As a retired physician, I recommend masks being mandatory in all public places and at all times. My gym requires masks to enter, but once clients enter, 75% of them remove their masks. Masks should be enforced for all exercise, even high intensity. If you can't tolerate the exercise with a mask, then you should not participate in the exercise. The next public comment is from Adrian Michelson. Adrian writes, my name is Adrian Michelson. I am a newer resident of Nevada here in Las Vegas with 7 years of professional experience working with data and data decision-making in a fast-paced environment. However, I want to write to you as someone with the knowledge and a newly diagnosed patient of stage 3 Hodgkin's lymphoma and now immunocompromised. I wanted to listen during the last meeting on November 5th, but unfortunately that was the worst day of my side effects for my first round treatment. I have caught up on the YouTube video, hence my written response here. First, I want to thank you and everyone for doing an impossible task. I duly appreciate it. It comes with obstacles and challenges that I do not envy. However, I want to ring the alarm a little harder and drill in a little more specifically about supporting holistic decisions or supporting broad recommendations to the governor to execute statewide to help flatten what will be another curve and make everyone's lives on the task force and subsequent local task force easier. I am asking for statewide recommendations from this task force be delivered to the governor to execute the flatten the curve for everyone in the state. My reason for alarm is also personal. When I found out my diagnosis on October 3rd after emergency surgery at Mountain View Hospital, my family flew in and was there that Sunday and helped me through the week. My dad is the academic chair of emergency medicine at Texas Tech of El Paso and the director of emergency services for the UMC of El Paso. When he and my mom visited, the caseload in the hospital for COVID-19 was a little over 30 patients. A month later, including with state support considerations with 200 plus COVID patients, and overall in El Paso cases are expanding as of November 4th. There are over 1,000 COVID patients hospitalized per the El Paso report. It's a tough decision. During the spike, the risk of travel means I am reasonably not comfortable asking my parents to help me with my chemo treatment here in Las Vegas, given my situation and their age risk, and I can't tell you how upsetting it is. I know I only speak for myself in this matter, but I know others are probably experiencing similar issues.
Megan, this is Caleb. That's 2 minutes. I need to go ahead and stop you and ask you to continue reading any additional public comment at this time.
There are 2 more. An anonymous writer writes, stop the COVID fraud. Break ranks before you each find yourself in prison for committing the greatest crime against humanity. This is a global totalitarian movement. Cases are meaningless propaganda. Death rate is less than flu. There is no emergency. End the mask mandate, social distancing, and tracing, and let us live our lives. Our human rights are being violated. We have a right to make our own health choices and decide which risks are appropriate for our lives. Some of us wish to live a human life, a natural life using our natural God-given immunity as protection, not the government. I have a right to religious freedom, and I do not believe in, nor should I be forced to participate in this new delusional religious cult of which one of the symbols is the mask. These sacrifices we have made in our lives due to overreach of government are killing us, and they are neither necessary nor small in disease is not being prevented by instituting them. Final public comment was provided by Katiana Taylor. She writes, "Dear Task Force, we've reached out to this task force to ask for discussion from members of this task force in the health department and are still awaiting a response. We have requested information about the PCR lab testing that is going on in Nevada. We not only wanted the data, but we wanted to discuss the data with the decision makers who are also directing the policy for COVID-19 here in Nevada. I was told to submit my issues in writing for your public comment. I am disappointed that I'm unable to speak with someone who actually has an answer to my questions, instead of just getting my 2 minutes of public comment that never ever is addressed. Someone from this task force, would please get a hold of me. My colleague and I would like to have a conversation. We are very happy to hear that Washoe County is no longer testing asymptomatic people. However, we are concerned that the cycle threshold value cutoff being used in Nevada is way too high and would like to ask that the cycle threshold value cutoff be lowered to 30 to 35 and that values be provided with the test results. We have found out from the UNR School of Medicine lab that they are using a cycle threshold value cutoff of 40 to 45. I understand this is likely the case in all Nevada labs. A CT value cutoff of 40 to 45 concerns us for a number of reasons. Many studies, including those done by the CDC and Dr. Fauci, have come to the conclusion that CT values of above 34 produce no viable virus and the patient is not infectious. If PCR screening is meant to find infectious individuals, then lowering the cycle threshold cutoff and providing the CT value with the test results at minimum should be implemented. A recent New York Times article presented evidence that specimens detected in 27 to 34 cycles rarely show any live virus, and specimens detected above 34 cycles never show any live virus. It's just kind of mind-blowing to me that people are not recording the CT values from all of these tests, that they are just returning positive or negative, said Angela Rasmussen, a virologist at Columbia University in New York.
Megan,
Yes,
this is Caleb. That's 2 minutes on this one as well.
thank you. That is all that I have to read into the record.
Okay, at this time, I would like to thank you for doing that, Megan. At this time, I'd like to open up and ensure that we're available for any additional public comment called in through the phone. Remember, if you are joining us remotely for public comment, to press *6 to unmute yourself and provide your public comment at this time.
Hello, my name is Lindsay Garcia and I'm calling from Henderson. And I would like to add a public comment to please remove the mask mandate and the social distancing and the contact tracing, and just to let us make our own health decisions. I would also like to make a comment in protection of all the children in Nevada. These mask mandates are causing them brain damage, restriction of oxygen, and psychological damage. It is a parent's choice if they want a mask or not, and this should not be enforced or encouraged. Thank you.
Thank you. Is there any additional public comment at this time? Okay, for members of the task force, I'd like to remind you that all of the public comment that was read into the record by Megan Worth Ranson this morning was provided to you in your email as a part of the the document packet for this meeting, and all of it is on the Nevada Health Response website as well, under the task force page for these meetings. I'd also like to remind everyone that during this meeting, because it is a public meeting, we will also have public comment at the end under agenda item number 9. At this time, I'd like to close out agenda item number 2, public comment, and move to the approval of the minutes for the November 5th, 2020 task force meeting. Megan Worth-Ranson and others have prepared these minutes based on the deliberations from last week. If members of the task force have had a chance to review, I'd be more than happy to hear a motion or any amendments that need to be made.
Caleb, this is Terry Reynolds. I'll move to approve the minutes.
Thank you, Terry. I appreciate that. Is there a second?
Dagny Stapleton, I'll second.
Thank you, Dagny. I appreciate that. We have a motion and a second to approve the minutes from the November 5th, 2020 meeting. Is there any discussion? Hearing no discussion, all those in favor, please signify by saying aye. Aye.
Aye.
Any opposed, vote no. Motion passes. Thank you. We'll update these and put them as a non-draft form on the website. I want to give a brief overview of the agenda here. You'll notice that there are a number of items that are, or at least the order is a little bit different, and we're going to take it a little bit different than the order presented on the agenda as well. We have an update from our Nevada Hospital Association member, Chris Lake, who will be providing an update on statewide hospital capacity. It's my understanding that he has brought with him Mr. Eric Olson from Renown, Mr. Mason Van Howling from UMC, and Bill Welch from the Nevada Hospital Association in order for him to help him provide that update on statewide hospital capacity concerns and needs during the pandemic, at least from the two major metropolitan areas. So we'll go to agenda item number 6 next. I will provide a brief overview of agenda item number 8, and then we will go to agenda item number 4, which is the meat of the agenda. We're going to ask that presenters provide a brief overview and have a discussion on those in light of the governor's recent press conference and statements regarding potential mitigation measures in about 12 days time, 10 days time from today, if we can't get the cases down. So that's an overview of where we are right now. I'd like to, at this time, go to Dr. Lake, Chris Lake, to open up agenda item number 6. And Chris, if you could introduce your presenters who will help you present on an update on statewide hospital capacity concerns and needs during the pandemic. The floor is yours.
Great. Thank you, Mr. Chair. I felt it was very important for this committee to hear directly from some of our hospital operators and be able to ask questions. So with me today to give a presentation to the committee, I have Mr. Eric Olson. Mr. Olson is the Chief Executive Officer of Renown Regional Medical Center up here in the Reno area. And I also have with me Mason Van Howling, the Chief Executive Officer at University Medical Center down in Las Vegas area. As well, we have Mr. Bill Welch, who is the President and CEO of Nevada Hospital Association, on the phone with us as well to help answer any questions. I just want to, before I turn this over to the presentation, I wanted to let everyone know the hospitalizations are continuing to increase. Right now, as of today, 18% of all the patients in the hospital have either confirmed or suspected COVID patients. I just wanted to throw that out there, and I know our CEOs and our presenters will help put that into context for you. So with that, if we could get the presentation up. I don't see that yet. There we go. And I will turn it over to Mason Van Howling, the CEO of University Medical Center, to get us started. Thank you.
Thank you, Mr. Lake, and thank you, Director Cage and the task force members for your time today to receive an update both from the northern hospitals, but also the southern hospitals. As mentioned, I'm Mason Van Houweling. I'm the Chief Executive Officer of University Medical Center. I also serve as the Vice Chair of Nevada Hospital Association and joined with our chair, Mr. Eric Olson from Renown Health. Before we get started, I do want to just take an opportunity to thank all of our frontline workers for their tireless efforts, giving it all to take care of our communities and our individuals impacted by COVID-19. So our sincere gratitude on behalf of Nevada Hospital Association. And Mr. Lake, do I control the screen here, or somebody going to advance the slides for me?
Megan, is that something you can do?
Just advise when you're ready for us to go to the next slide and we'll do it from our end.
Okay. There you have it, both Eric and my titles and representation. Next slide, please. Well, we just wanted to, first of all, say thank you. Early on, there's a lot of lessons that we have learned, and obviously the stay-at-home orders in early March and April had a significant impact on our ability to prepare over the last 9 months. And we've learned a lot, whether it's treatments and given us time to prepare to, whether it's PPE or the state waivers and emergency orders, certainly gave us time to prepare for our current position today. We've learned a lot. Healthcare organizations have been able to prepare and refine our processes to promote better outcomes, both in treatments and therapeutics. We'll be talking a lot about PPE a little bit later on, but given us the ability to really source and supply chain our PPE efforts to protect our healthcare workers. We've also developed plans to be able to increase overall bed capacity and ICU capacity, what we'll talk about in great detail towards the end of the presentation. And then also as I reflect where we were back in March and April and our ability to test and turnaround times, we have dramatically expanded testing capabilities throughout the state. Just the current status and capacity, as Mr. Lake referenced, the numbers do indicate that we're increasing in positivity, emergency room visits, hospitalizations, and also ICU visits. Currently, Southern Nevada hospitals have not had to activate any surge plans at this point. We're in a stable capacity, but we are ready and positioned to respond very quickly and execute our plans. We'll also talk about Northern Nevada's situation, and obviously they're experiencing capacity strains due to the higher positivity rate that Mr. Lake referenced. Next slide, please. So this is a snapshot of currently where Southern Nevada hospitals are. This is actually dated November 10th. Probably as we were speaking, the latest report came out as Chris referenced, but in Southern Nevada, the overall hospitals that are reporting, we have 4,686 beds in our community. Of those 4,000 plus beds, 84% are currently occupied. As of this date, COVID-19 patients represented about 14.7% of the overall capacity at hospitals in Southern Nevada. ICU beds, we have currently 730 beds in our community. 66% of those beds are currently occupied, but representing COVID patients is about 32%. Ventilators, we appreciate the state's efforts, the county's efforts to help us secure ventilators very early on in the pandemic. We are well positioned regarding ventilators. We've also learned a lot about ventilators use, and that early intervention for ventilators is not always the best outcome for patients. So we try to reserve those as last resort for our patients. But of the 915 ventilators that are in our community, 30% are currently occupied. And of the occupied ventilators, just under 30% are COVID patients. So you can see we're well positioned on ventilators and the supplies that go around that ventilators. Staffing levels are green currently for Southern Nevada hospitals. And then PPE, we intentionally keep PPE in the yellow, although we're all very well stocked and have warehouses of PPE throughout our communities and the hospitals. We intentionally keep that yellow because we never want to let down our guard related to protecting our frontline workers and our patients. Next slide, please, and I'll turn this over to Mr. Olson to describe what the current situation in the Northern Nevada hospitals.
Thank you, Mason, and good morning, all. My name is Eric Olson. I'm the Chief Executive Officer at Renown Regional Medical Center. And I also serve as the board chair of the Nevada Hospital Association. Similar to Mason's report on Southern Nevada hospital statistics, you can see here where our statistics are, and I won't go through them line by line in the interest of time, but just would like to point out relative to PE, for example, all hospitals across the state have a very rigorous process of evaluating on a daily basis what our inventory is. And fortunately, supply chains have improved since early spring when PPE was a significant concern for us. So we watch it closely to ensure it's not a variable that would impact us unfavorably from a hospital capacity standpoint. Anyway, so you can see where we are from a statistics standpoint. Next slide, please. So I appreciate the opportunity today to maybe share with you a little further insight from a hospital operator's perspective around hospital capacity and what can drive hospital capacity. So the next 3 or 4 minutes will be my attempt to do that. And please, if you have any questions, just raise your hand. But there are several ways to report on bed capacity. You can look at licensed beds, which may or may not actually reflect the occupancy potential due to different reasons, like beds being under construction or not having staff. You can look at staff beds, and one of the variables that impact that is just it's a fluid environment. Typically, nurses work 12-hour shifts, for example, and so you may have staff beds at 8 in the morning, but at 8 p.m. it may be a little different, just again depending on your staffing availability. And then we can look at flex capacity, which we don't report. It's really not defined, but hospitals build into their emergency management contingency plans where they have the opportunity to flex hospital space or non-hospital space into some additional capacity for care. And so really the upshot here is that the capacity is not a static number. The denominator can move due to physical beds, staffing, and contingency plans. Next slide, please. So what are some key drivers to increasing bed availability? Well, you can acquire, or you can manage utilization, or you can manage throughput. And there's some examples of different tactics there in this table. Next slide, please. So, and we'll get into some of those other management tactics here in a minute, but I first wanted to back up and talk a little bit about how hospitals fill up. These numbers are numbers from Renown Health, but they are reflective of really the hospital industry, and they're proportionate to a hospital size. So for example, UMC has generally the same statistics, just at different numbers. So the 65% of hospital admissions come from the emergency department, but they represent 93% of the hospital census. Whereas opposed to surgery, 35% of our admissions originate from needed surgical interventions. However, that only pulls down about 7% of the hospital census. And when you look at that, population, a subpopulation of the ICU, those scheduled surgeries only pull down about 1% of an ICU census. So this is relevant as it pertains to conversations and discussions about what people call elective surgery. I think within our industry, that's a bit of a misleading term. Very few surgeries are truly elective. These are medically necessary procedures, and the risk of not having access to surgical intervention timely is a deterioration of your community's health. The demand doesn't go away, it just is suspended, and it creates logistical challenges for hospitals to suspend and then bring surgery back online at a future date, in trying to figure out how to bring that suspended surgical demand into an already busy environment. And so if the support that's needed from a hospital's perspective is to allow local hospitals the decision making regarding scheduled surgeries. We all have very robust processes from a management perspective that include our medical staffs and physicians. And our priority is always patient safety and patient care. The interruption to care, as I described earlier, leads to a decline in health, higher costs, and creates downstream logistical challenges. Next slide, please. So managing utilization of beds is one way to help ensure that there are beds available to patients who need them. And so specifically, we talk about length of stay in our industry, and that's how long a patient stays in the hospital. The purpose of this slide is just to show you, and these are renowned health statistics, but they are consistent again across the industry. Really what we're seeing with the prevalence of COVID is almost a doubling in our length of stay. These are sicker patients in many cases. So where we would normally be running somewhere around a 4.5 to 5.5 day length of stay, we're starting to see in non-ICU and ICU settings of COVID patients that length of stay doubling, and that is drawing down on hospital capacity. I'm going to talk here in a minute about some other key drivers around bed utilization, but really what's driving it is patient acuity, limited access to post-acute beds, which I'll talk about in a minute, and a subset of that is some challenges with guardianship laws and procedures. So next slide, please. So this is a snapshot again of this data was taken from Tuesday of this week, and again, this is not dissimilar from other hospitals in the state. Renowned hospitals have 55 patients currently within our facilities that do not need acute hospital level of care. And I've shown here in a little bit more detail the reasons why. So 16 are pending long-term SNF placement, 14 are pending guardianship decisions. You can go down the list. So let me try to provide a little context to this number. Maybe taking a traditional staffing ratio, you might staff at a 1:5 ratio. So these are 11 nurses every day on a day shift. You would need a second shift. So you're looking at 22 nurses, not even counting for other staff members, to essentially care for patients who no longer need acute level of care. So when we talk about hospital capacity and things that we can do to improve access to hospital beds, especially in a time of a pandemic, this is pretty significant. So we are looking for some support to create post-acute care access by adding resources. And by no means do I want to suggest that guardianship laws and procedures are an easy solution. There's an easy solution to those things. I know that a lot of really talented, smart people have been involved in this for many, many, many years. But I do think it's important that as a state and certainly as an industry, we continue to look at how we can improve the process of guardianship laws and procedures so that patients who really don't need acute level of care can transition to an appropriate setting. Next slide, please. I just briefly want to educate those who may not be familiar with a term, hospital divert status. You may hear that from time to time. And again, I'm using Renown as an example, but it's proportionate and the same in all facilities. At Renown, we have anywhere from 90 to 110 patients that enter and leave the facility. So about 100 are leaving every day and 100 are coming every day. And that's challenging. And you can equate that perhaps to air travel, but the use of divert status is similar to maybe calling a timeout in sports. It kind of stops the clock from moving. And so in the clock in this case would be ambulances from bringing patients to your hospital. And so really that timeout is typically shorter in duration, and it allows your facility to prioritize discharges, mobilize resources to help moving of patients. I do think it's important to note that trauma centers do not go on divert. We keep beds available so that valuable resource is not compromised. But as I just equate it to the airline travel industry, we've all experienced it where we may be in a terminal and we may be waiting to leave and our flight's delayed. Maybe we're waiting on a crew to come in from a different city, or the plane has mechanical problems, or there's weather. And so what happens? You go to that next picture. You begin to see planes back up on the tarmac. And that would be equivalent to patients in the emergency department. Typically, patients can come in and their episode in the emergency department can take a few hours or less before they're admitted into the hospital. But when the hospital is working through getting 100 people out, sometimes we back up in the emergency department. And so when that happens, in airline air travel, hopefully you've never had to experience it, but if you have, you can circle the airport. Well, that would be equivalent to ambulances looking for other hospitals if your hospital goes on divert. So there's some logistical challenges in moving people through, but typically divert status is short in duration, and it's really just used to help facilitate the movement of patients to create capacity. Next slide, please. This is perhaps one of the most important pieces of information in the presentation today, and that's staffing and staffing challenges. I think it's important to recognize that prior to the pandemic, hospitals and our healthcare industry overall were facing shortages of labor, physician shortages, nursing shortages, allied health professionals, and others. So we started at a deficit. So what's different now with COVID-19? What is it driving? Well, it certainly has driven early retirements. That's a factual statement. We've had people who had intended to work for 2, 3, 4 more years who have just said, I don't need to do this anymore. And that's really hurt. Caregiver quarantines due to household exposure. Hospitals have varying rules, but we typically all follow the CDC requirements and guidelines. So if somebody in your household is exposed, we could have a caregiver quarantined, up to 2 weeks. And so again, all hospitals are experiencing this now, certainly with the prevalence of COVID increasing. There's increased competition for a limited resource nationally, and that is significant. All across the country, health systems, hospitals are dealing with a shortage, and there's a high level of competition for those resources. And nurses and other caregivers are choosing to maximize earning potentials. And so, as an example, we're hearing now that agencies are paying upwards of $5,000 a week for nurses to take traveling assignments and go to different parts of the country. And so it's getting increasingly competitive for a resource that's low in supply. So there are some short-term things that I believe have already been done, and we appreciate that, which is recognition of licensure in other states, of reciprocity of your licensure. But long-term, we really need to be focusing on funding GME, nursing, and other allied health programs to ensure that we have in Nevada an adequate supply of talented caregivers on the front lines. Next slide, please. So I briefly wanted to just demonstrate our ability to surge or to add additional bed capacity. And again, other hospitals in the state have similar plans, and Mason will kind of walk through Southern Nevada in a second here. But Renown has built an alternative care site that has the potential to open an additional 1,400 beds if needed. Again, staffing would be a challenge there, but the physical location is established. We're doing things like leasing skilled nursing facility beds. We'd run them as acute care beds, but you can think of it as a hospital inside of a skilled nursing facility. And we have active plans to turn that on in the coming months or so. We did repurpose an LTAC that was in one of our hospitals and picked up an additional 39 beds. And I want to recognize the licensure agency within the state. They were very responsive and helpful in getting that done timely. And I'm also really proud to talk briefly about remote patient monitoring. And we put on here about 20 beds. So there are patients in the hospital that still need to be observed. But we have technology now that allows us to monitor those patients remotely. And so we can do home health visits to ensure the environment's appropriate, the technology works, and it works for certain populations of patients. But if they have the ability to ambulate and they have the means to communicate via telephone or video, we can begin to hook patients up and monitor them remotely. And that's something that we're turning on this week that was driven by our Chief Medical Officer, Dr. Paul Szerzinski, and we're really excited. This will free up a number of beds that are greatly needed. So next slide, please. And so I'm going to turn it over to Mason. And again, thank you all for the opportunity to share with you some of this information.
Thank you, Eric. And as Eric mentioned, the ability for Renown to flex up an additional 1,500 beds. Just wanted to share with you Southern Nevada's plans. And again, during that stay-at-home order time, we collectively, as a county, worked together to be able to shore up our existing plans, but also create new ones. And I'm going to start at the acute care hospital surge plan. So there are 19 hospitals from Boulder to Mesquite and in between. And each hospital has their own internal surge plans to overflow in areas that typically would not be cared for patient or normal operations. So pre-op areas, post-operation areas, observation areas have all been developed. And each hospital roughly has about 25% capacity growth beyond their licensed beds. So when you look at the internal plans of those hospitals here in Southern Nevada, that equates to about 871 total beds. We've also worked collectively in the county and with the city and to set up an alternative care site that we've actually demobilized, but it was very beneficial during some of the peak months. The April, May, June, and July months was the Cashman Care Center at Cashman Field. That allowed us to flex up to 300 beds, specifically targeted towards our homeless population. And we wanted to ensure that we're able to keep some of the shelters open because of the demands during this time on shelters, but also give an alternative care site to be able to treat those patients in a safe fashion so they can continue to operate and serve our communities as they've done for many, many years. Also, the Southern Nevada Health District has created an alternative care site, not currently in operation as well, but it stands ready to be utilized should it. That's 45 beds. And as Eric mentioned, each of our hospitals also has other relationships to overflow to post-acute care facilities, long-term care, nursing homes, and other treatment areas. And then lastly, I just want to say thank you to Chief Steinbeck, the Las Vegas Convention Center, and the county's support of the Las Vegas Convention Center. We have a tiered-in phase approach to be able to flex up ultimately to 900 beds at the convention center. The supplies, the equipment stand ready, but fortunately, we've not had the need to be able to execute and open up the convention center. But again, that serves at 900 beds. So when you add in all those measures and levers that we have in the community, we can flex up to another 2,100 beds within Clark County. Next slide, please. As I mentioned, each hospital has their internal surge plans. We shore those up. We've reviewed them over and over and continue to look at those and drill them. There's about 25% increase in licensed beds, as mentioned. We also continue to monitor and limit elective surgeries to ensure that we have ICU capacity, medical surge capacity for the treating of COVID patients. Many of our hospitals are also testing their patients coming in their doors, whether it's for surgeries or in the emergency department, to make sure we quickly identify COVID positive patients, both asymptomatic and symptomatic. We continue to monitor that, but during the stay-at-home order, we did have pent-up demand, and we appreciate the community postponing, delaying procedures that could allow us to be prepared and create our surge plans. Things as tumor removal, transplants, hernia repairs, radiation treatment, and certain heart procedures continue to go on so we don't create more harm by delaying patient care. Next slide, please. So let me talk a little bit about the flu, and that's been always the concern for healthcare providers and public health, the convergence of two viruses at the same time, especially as we get into the colder winter months, as immune systems get suppressed, respiratory illness, flu-like symptoms, the flu converge at the same time. We have seen interest in the flu shot more than in previous years. All the things that we're doing, social distancing, mask use, sanitizing, has definitely reduced the impact of influenza at this point. My slide is a little outdated. We actually have 2 hospitalized patients with the flu. This is as of yesterday, 1 in the north and 1 in the south. But again, we encourage folks getting the flu shot, staying home, protecting themselves if they're sick, not going into work and spreading the flu. But so far so good on the flu, which typically brings us up to our high capacities on an annual basis, especially during the winter months. Next slide, please. I just wanted to show a little bit about UMC's volumes since March and currently through October. As you can see on the left side is our UMC total admissions. And clearly you can see March had an impact on people staying at home, staying healthy, and not getting injured and going out and contracting COVID-19. As things continue to open up, as you can see, the direct correlation is opening up. What happens with admissions related to COVID, but also UMC serves as Nevada's level 1 trauma center. Renown is also a trauma center. And as things open up, we did see more car accidents, injuries, unfortunately violence in the community. So as you can see, we were ticked up, but not have we hit or exceeded 2019 volumes. So we still have continued capacity currently at the moment. And then on the right side is our emergency department visits. Pretty much same story. Patients only sought out care if it was a true emergency. You can see the sharp decline from March to April. And then as things opened up, we continue to manage the patients that we care for at UMC, but still have not hit our 2019 levels. Just demonstrating that we have capacity. This is a similar story throughout the Valley to include the Valley Health System, HCA, Dignity, North Vista. They're seeing similar trends, 10 to 15% off of their last year's volumes. Next slide, please. So a little bit about testing. We've come a long way in the state regarding testing, but happy to report testing is widespread and available. To date, UMC just alone has done more than 400,000 and approaching 500,000 tests. We do. Both Renown and UMC use the Thermo Fisher PCR platform. It's very effective, very sensitive, and very specific. Renown has done about 50,000 tests, and both facilities have less than 24 hours of turnaround, actually far below 24-hour turnarounds. And I do want to say thank you. I know many of the health district public health officials are on the call and on the phone, but contact tracing has been a big game changer. It's essentially real time as we're resulting our test to the patient. The health districts and contact tracing is happening very quickly so we can intervene and slow the spread of the virus. Next slide, please. This is just a little bit about the current case demographics. This is from Nevada Response NV.gov. So this represents the current positivity rate, but also just the confirmed cases and the demographics. As you can see, 20 to 29 is our biggest amount of confirmed cases, followed by the 30s. When you look at this number, and I reflect back to April and May timeframes, there definitely has been a shift in the younger population in confirmed cases. Very early on, it was the 50 and above, and obviously a little older population, more vulnerable, having underlying conditions that exacerbated by the virus. But as you can see, the shift, dramatic shift in the younger population. So certainly an area we want to target. As far as gender, does not discriminate. Here we've got 51% women, 49% male, so very close split. But when it comes to race, as you can see, Hispanic population of the cases represents about 43% of the overall population, and then followed by white. There are certainly a lot of efforts that we're all doing to target this population, efforts and campaigns to support to make sure we get out the word to protect yourselves, but also your loved ones at home. Next slide, please. I'm just going to talk a little bit about treatments and therapeutics, and we have seen an incredible evolution of treatments that we've learned from the beginning, from the lessons learned about hydroxychloroquine, remdesivir, the advancement of Regeneron that will be hitting hospitals in Nevada very soon, and then we appreciate the state support on Eli Lilly's new product to be able to help assist and block the virus from entering new healthy cells. Treatments, ventilators, as I mentioned, we're really good there. We've got plenty of ventilators, and all the things early on about splitting ventilators. We've never had to do that in the state, but we learned that practice. But again, ventilator use is the last resort. We have realized that that is not the first treatment that we want to do. We're using high flow oxygen cannulas. Proning of patients seem very effective at the bedside. Again, I appreciate the task force and the state support on receiving pharmaceuticals and getting our hands on that supply chain for all the hospitals in the community. And then we're very closely watching the vaccine. Both Pfizer and Moderna are in their trials with no safety holds. You're hearing a lot about that, and we're working through how do you prioritize that supply? Where do we get it to the front line, the EMT, the healthcare workers, but also very quickly, how do we roll that out to the community and prioritize the public as well? So we're working very closely with the states, the health districts, and our hospitals. Next slide. So we just want to leave in closing on how can you help as a task force? We again appreciate the governor reminding our community that wearing and promoting safe mask wearing, social distancing, and really putting on individual Nevadans that this is all of our responsibility. We're extremely supportive of the messaging that happened this week. We do need to flatten the curve because we know positivity rates and growth in positivity rates directly reflect to the emergency departments, the ICUs, and ultimately deaths. So we want to definitely get ahead of that, and we appreciate his messaging. And we need all Nevadans to take the advice and stay at home if you can. Also, we continue to self-monitor our elective surgeries to make sure that we are managing the capacity and making sure that we're ready for the surge. As Eric mentioned, we are having some difficulties moving patients through the continuum. So if we can get some assistance there. You heard Mr. Olson mention about guardianships. That certainly helps move patients through the system, get them in the right setting and care. And then also just ensuring that we meet the demands for testing. Obviously, as positivity rates go up, exposures happen, and we want to make sure that we are able to test our community in a timely manner. And then ultimately, really for down the road is the importance of having our staff, as Eric mentioned, having a workforce that is there for us to be able to treat our communities, but supporting graduate medical education, nurses, doctors, be able to care for our community in the long term. So with that, Mr. Cage, completes our presentation, and Mr. Olson and I will open up to any questions the committee may have.
Great, thank you to you both, Mason and Eric. This is Caleb Cage again for the record. Chris, I really want to thank you for bringing in the board leadership from the Nevada Hospital Association in order to provide this update. I think that this is not an easy issue at all, and I've learned in the last 8 months that hospitalization and hospital capacity are really not simple values in and values out sort of equations, that they're very dynamic and very complex in order to figure out exactly where the hospitals are and when they're at a critical status. So just being able to bring partners together to get this update, to get it out in front of everybody is extremely valuable to me. And I want to say thank you to our two representatives from NHA here as well. A couple of things I'd like to ask here and then open it up to the task force here. Actually, before I do that, Chris, did you have any concluding remarks or any wrap up you'd like to do before we go into the discussion?
No, the only thing I would say is I felt it very important that the committee get to ask questions and hear this right from the boots on the ground operators. And while we brought two of the largest hospitals here, the story and the information that they communicated is essentially the same, just scaled differently based on hospital size. So they are very willing and able to answer questions that the committee will have for them. Thank you.
Thank you very much. So I know back in, this is Caleb Cage again for the record. Mason, I know 3 or 4 months ago, well, I guess it was June, July, when Clark County numbers were peaking again, late July, early August, I guess. We had a conversation with the Skilled Nursing Facility Organization, the Nevada Healthcare Association. Can't remember the name of the actual organization. I apologize to Mr. Salmon for that. But we had a conversation with them for regarding what that what the procedures were for moving folks who no longer needed hospital care into skilled nursing facilities, addressing some of those guardianship issues. And I think Mr. Olson said a moment ago, not disparaging any of these measures that are put in place. They're put in place to protect vulnerable populations. And I know we all agree with that intent 100%. If there are ways that we can increase hospital capacity while also protecting those vulnerable populations, that's certainly something that I think we could re-engage in from the state's perspective in order to coordinate those conversations and see what's available. I know that there were some resource perspectives, some policy perspectives, and other things that were a part of that. But I think that one follow-up from this meeting would be, an easy follow-up from this meeting would be to convene that group again, state regulators, hospital representatives like yourselves and Mr. Salmon, and get everybody back in under discussion for that as well. Obviously, I really appreciate the context you provided about the healthcare workforce shortages prior to the pandemic and then exacerbated by the pandemic itself. And I know that's something that, as we rebuild in the new Nevada, whatever this is going to look like over the next 5 years, I think that's a really important policy perspective, and one that I know is going to be very important for us going forward as well. So I appreciate you bringing that up. Just kind of wanted to highlight the two really clear deliverables or next step conversations from my perspective based on your wanted to see. So just make sure I understand this, Mr. Olson. I believe, based on the public reporting and things I'm hearing privately, the alternate care facility that Renown, I congratulate you for your foresight and hard work back in March, April, May in developing this alternate care facility on site. And Mason, I know you and Chief Steinbeck and others were doing the same at the convention center. I understand that Renown will start putting patients in the alternate care facility as early as today. Is that your understanding as well, Eric?
Yes, Mr. Cage, thank you. That is correct. We are utilizing the alternative care site today. We are starting with a small population. We'll use 20 beds in that facility this morning, and we will take it in increments as needed in a manner in which we can safely provide care to those patients. The facility, it does not have telemetry and ICU capabilities, so the population or that subpopulation of patients that will use the alternative care site to deliver care would be a lower acuity COVID population.
Great, thank you very much for clarifying that. I heard something different in your remarks, so I wanted to just clarify that. Thank you, Mr. Olson. And then Mr. Van Houweling, just follow up on your presentation as well. You're near the end of your presentation. There were two charts side by side of hospital capacity 2019 versus 2020, and an ICU capacity 19 and 20. And am I reading that correctly to say that you're 10% under 2019 capacity, even with for today's date to date, November to November, from 2019 to 2020, even with the increased COVID capacity or COVID patients?
Yes, Mason Van Houweling for the record, but yes, Director Cage, that's exactly what we're trying to demonstrate there. And I've had many conversations with the other healthcare systems that really support Las Vegas, and they're seeing the similar numbers as well. So I think that's a combination of a lot of things that are showing that we're not butting up against our prior year volumes when we were able to manage those. And we're busy every winter with flu. And again, I think combination of people still staying at home, being safe, But as things have opened up, obviously there's injuries at work and auto accidents and burns and things that have heart attacks, strokes that are still in our community that we're continuing to treat those patients. But we're still managing those surgeries coming in to make sure that they're appropriate, that they don't tie up a valuable resource in the ICU or a medical bed. And then the other issues, as we mentioned, that Mr. Olson was talking about, some of our throughput through the continuum is putting a little bit more pressure on this currently than we normally experience. But I appreciate your comments. And again, we would certainly love to partner with the committee to be able to help solve those problems. But that is the theme throughout as we stand today. Again, very supportive of the concern of the positivity rate, because that could very quickly change if we do not get things back under control. Our testing sites, Mr. Cage, as you know, we've got great testing here, both at Cashman, UNLV. We're opening up the Texas station to be able to address more testing. But those positivity rates are climbing at an alarming rate. So again, we're very supportive and hope all Nevadans listen to the advice that was given this week, and let's be able to get it back in control. But currently, we're not exceeding our 2019 volumes, and that's pretty much a theme of every hospital here in the South.
Thank you very much. I appreciate that, Mr. Van Houweling. I'd like to open it up to other members of the task force to see if there are any questions or comments regarding this quite informative and excellent presentation. I really appreciate that from the NHA board members. Any other comments at this time or questions?
Hi, Caleb. This is Lisa Sherrick from DBPH. I just wanted to thank the group for the presentation, and our staff at DBPH, the regulatory arm, have already reached out this morning after those numbers were presented to see how there may be some assistance as we tried to do previously with the Nevada Healthcare Association and Hospital Association on finding appropriate placements, of course, ensuring that the individuals meet the discharge requirements for a safe and appropriate discharge, so we can see how that can be potentially worked out to support the hospitals. Thank you.
Thank you, Lisa. Yeah, that is a great next step, and we'd love to have updates on that as well, to make sure that we're assisting in those. The slide with the 55 patients that Mr. Olson put together was I think very, very informative in that sense. So thank you for taking the lead on that. Any other comments or questions to the Nevada Hospital Association representatives here on this agenda item? Okay, thank you all. I know you are extremely busy serving your communities, and I just want to say thank you again for joining us here. We wanted to front load this agenda item, so that we could have this as perspective as we go into the mitigation plans, but also to respect your time as well. So thank you very much, and Chris, thank you for coordinating this agenda item. We will go ahead and close out this agenda item at this time, unless you have anything further to add, or Mr. Van Houweling or Mr. Olson have anything to add in conclusion.
We just appreciate everyone's support. We really do, and thank you for your time today.
I would agree. Thank you so much for the time and all the support and the work that this task force is doing. It's very important, and thank you.
Thank you both. We appreciate it. Thank you, Chris, as well. We will go ahead and close out this item of the agenda, which is agenda item number 6, and we will move to, I'm going to leave 7 and 8 for later because they're brief updates. Like to go ahead and move up to agenda item number 4 at this time. We have 8 counties that are included on this for presentations. And I know that we have had very lengthy meetings in the past on this, and I know I don't want to give any of it short shrift, but what I'm going to ask for is for Clark County to be prepared to go first. Chief Steinbeck, I saw you on earlier. I don't know if it'll be you or Chief Samuels, but a representative from Clark County to go first, and then Carson City to go second, and then we'll go to Lincoln County third, and we'll go from there. What I'd like to ask of our presenters is to give a brief overview of the plan or the assessment and the plan as it stands right now. And what that brief overview should consist of is just 2 to 3 minutes long, an overview of where you stand in the community. We've all got the documents that can go through and provide specific details. And for many of the counties, we've had long conversations. But in light of the current surge in the state, what I'd really like to focus on is any recommended changes that are in the plan based on any of the increased needs that are going on, so we could have a discussion from there and really get to the important aspects of the discussion here as rapidly as possible, especially given that we're 8. I'll tell you up front, my focus is going to be after Governor Sisolak's Tuesday evening presentation with the request from residents throughout the state that we continue to observe, or that we increase our observance of the mask mandate, that we stay at home as much as we can in order to stop the spread, that we look at the hospital capacity surging, especially in northern Nevada, the Reno, Sparks, Washoe County area, and we really work to make sure that we are putting in mitigation measures that can slow the spread, stop the spread as much as possible, so we don't find ourselves in situations where we have to take increased mitigation measure, a position for increased mitigation measures throughout the state in just under 2 weeks' time right now. I know we all know that's a challenging timeline. However, there's nothing about this pandemic response that has not been challenging. So my focus is going to be, again, to hear from our county and district partners regarding the increased mitigation measures that are being taken in order to prevent those large-scale mitigation measures throughout the state in a couple of weeks' time, in order to protect health, safety, and critical resources here in the state. So with that, I'd like to go ahead and turn it over to Clark County and get an update. Again, please keep it brief on the current situation assessment, and then specifically focus on any of the essential changes that you've put into your plan based on your the current needs that you've identified. So Chief Steinbeck or Samuels, would you like to go ahead and go?
Good morning, Chair Cage. This is Billy Samuels.
Morning, Billy.
I'm going to try not to repeat everything that the hospital's already talked about, but that is obviously an importance for Southern Nevada. All the expectations that we had prior to all this, they are coming true. We knew the numbers were going to increase, but that is expected, so we're not really too surprised about it. Obviously, the 6 critical statewide metrics that the state has put forth really keeps us on line on what we're doing. Like Mason said, we are adding a 3rd site tomorrow for community-based testing at Texas Station. That's going to give us continuous 7 days a week for all of our testing sites. That's going to be our surge that we're going through. But one thing that with all the increase in testing, that the case investigation and contact tracing is actually improved. When you guys look through our numbers in the charts, I think I left in the numbers from last report to show that we're actually improving on that side as well, which is actually pretty nice. 3 of our other partner jurisdictions are also starting to provide more community-based testing. That's Henderson, Boulder City, and Mesquite, and that third plan is actually encapsulated in ours as well, so you guys can see that. Also, strike teams. So we're all increasing strike teams. Everyone's gonna start doubling what they've been doing. I put our community-based testing events for our strike teams in my report as well, with the highest zip codes that we have been seeing and the ones that are surrounding it. And so we're expecting to double those as well. That's been come down from regional policy, and that is what they would like to see, and we will be able to push that out. From your recommendations last week, Chair Cage, Southern Nevada Health District has already been working on a COVID Trace app that has been pushed out. They've been doing it with their flu clinics and pushing out flyers as well. I've given you a list of the distribution locations that has been given out. And so we're increasing that COVID Trace app. I haven't heard of the numbers from Julia, but hopefully those numbers are increasing with people applying for that. Again, Mason talked about, and renowned CEO was talking about medical surge area command. We obviously are ready to go for that. 7 months ago, we did see that increase in positive COVID patients. This would have crippled the hospitals now, but they've done an amazing job. The collaborative effort that we have a weekly call with all of our representatives from the 4 major groups, and they're all very comfortable. They communicate well with one another to make sure that we're not having that. One thing that I would like to read is Clark County needs assistance from the state of Nevada and the regulatory agencies to improve the process of that low acuity patients. And again, I'm just echoing what both North and South have been telling you guys as well. We've seen our highest numbers since August, yet Clark County hospitals, we still have capacity, as Mason has said. We stepped up our collaboration as far as large gathering plans with OSHA, Southern Nevada Health District, Gaming Control Board, and then they added on the Nevada State Athletic Commission, which I think is actually extremely important. Something that is not in my report, but we have reached out to the young professionals group, ages 18 to 26, and they've been contacted by our Chamber of Commerce to start doing more of education and informing that group of age about the importance of social distancing and masks. That's it for my report, Chair Cage. I'm happy to answer any questions.
Thank you, Billy. I appreciate that. And I'm looking over the agenda here, and there's a reason why you didn't get the COVID trace numbers, and that's because I skipped that part of the presentation and went straight into the counties. My apologies for that. So Kyra, if you could go ahead and be prepared, you and Julia, please be prepared to provide your update following the Clark County discussion here. That would be extremely helpful. Thank you for the update, Billy. You know, I'm looking at some of the increased measures that you're putting in place right now. We have this. I've lost it now, but the shred and swab event that you've planned in Boulder City, where people can go and have imported documents, private documents shredded, and also access testing. That's an interesting concept, and would love to hear about how that works out for your communities there. I know other communities have connected the tests to flu shots and others, so that's excellent. The increased strike teams going out and increasing enforcement, increasing focused outreach to specific demographic communities where we're seeing increased cases, and increased testing across the board. I think these are important measures that are in place right now. And again, I think it's, given your hospital status, there are some things that can be done on the hospital side as far as making sure that the patients who are in the hospital who don't necessarily need a hospital level of care can be transitioned out in a safe and healthy and responsible way. So I agree. Again, I think this is an excellent update that meets where your community is right now. I'd like to open it up to other members of the task force at this time.
Caleb, this is Terry Reynolds. Just a question from Clark County. We're seeing, a lot of events that are being approved. We're seeing a lot of requests for events that are for approval. And I'm wondering, and I know there's later on the agenda, but are we seeing any activity coming out of those events? And should we be looking at kind of downscaling the number of either spectators or people involved in those events to be able to stem the tide for a while, to take a couple week or 3 week breather with those? Is there something we can do in that respect that Clark County would suggest.
This is Misty Robinson from the Southern Nevada Health District, and in my part of the agenda, I will be going over that. Right now, it looks like we are in the red, but I'm trying to get confirmation on that. So we would not be recommending any plans moving forward at this point. However, I'm qualifying that with staff, making sure that that is the correct statement.
Okay, thank you.
Thank you, Terry. I appreciate that. And I'll reiterate, I know that there are a lot of moving pieces on putting these together, but Chief Samuels and Ms. Robinson, as far as those two items go, I think we may want to just go ahead and combine the agenda items, the two different agenda items from the local health authorities and the counties into one, so that we can address those as a part of specific plans. Because as Director Reynolds points out, that's a critical mitigation measure that I think we'd all like to consider when we're approving plans as well. So if you could confirm that aspect of it, Misty, that would be really helpful for us as well.
I do have that confirmation now.
So it's in red, and can you go ahead and give us your report as well?
Sure. So I want to direct your attention to the document labeled 5B in your packet. There was some confusion last week in my statement that I would like to apologize for, and wanted to make sure that everyone was clear on the parameters that SNHD is using to recommend approval for large gatherings. This document is also located on the SNHD COVID website under guidance for businesses and permitted facilities. As I stated last week, in addition to ensuring that public health standards are being met, we are using these 4 criteria to evaluate large gathering plans based on the public health infrastructure at the time: 7-day running average of cases, case investigation and contact tracing capacity, 7-day positivity rate, and hospital capacity reported by the Nevada Hospital Association. The parameters will be analyzed to determine if we are not trending towards surveillance capacity, or approaching or exceeding surveillance capacity. If you look at the chart on page 2, we have identified how each parameter is defined with a green, yellow, red coding scheme with the specific numbers we are using to identify each parameter. If one parameter is trending towards surveillance capacity, which is the yellow column, surveillance capacity with, then the pertinent jurisdictions will be informed that events scheduled more than 7 days from review could be canceled if the public health infrastructure approaches or exceeds capacity, which is the red column. If that parameter returns to not trending toward capacity, which is the green column, for 3 consecutive days, then SNHD will inform the pertinent jurisdictions that the infrastructure is not trending toward surveillance capacity. If any 2 indicators are found to be in the red column, SNHD will not recommend approval of the plan. If the average new cases or the case investigation capacity is found to be trending in the red column, SNHD will not recommend approval of the plan, and SNHD will recommend that all scheduled large gatherings are canceled or postponed until all parameters are in the green or yellow columns for at least 3 consecutive days. As of today, the 7-day average of new cases per day is in the red column. Case investigation and contact capacity is green. The 7-day positivity rate is red, and the hospital capacity is green. Therefore, at this time, our overall capacity is in the red column. Therefore, we are currently not recommending approval of large gathering plans. SNHD staff are working to add the daily criteria to the SNHD COVID dashboard so that this information is completely transparent to event planners. It is important to note that SNHD is not the deciding entity on any large gathering plan. There are several agencies involved in that decision process. We can only make recommendations based on the public health infrastructure at this time. And from 11/3 through 11/10, SNHD did recommend approval for 9 large gathering plans. However, they may be pulled back. And that's my report.
Thank you very much, Misty. I appreciate that. That's an excellent overview, and I think it's very helpful to our discussion here today. So thank you for providing that. I just want to say that for the sake of the minutes, we just jumped from agenda item number, we just jumped from agenda item number 4, where we were seeing 4B in Clark County with the Southern Nevada presentation from Billy. We just jumped to number 5, and Misty's update was 5B, the Southern Nevada Health District. So at this time, want to go back to agenda item number 4, and we won't bounce around like that anymore. I just think it was important to hear that. Does anybody have any questions or comments additionally from the task force regarding Clark County's plan at this time? Any thoughts or recommendations on how we might need to proceed at this time from the task force?
This is Kyra Morgan, for the record. I just wanted to make a brief statement kind of reminding us of the conversations that we had in early task force meetings. And I really appreciate the presentation that was just given by Southern Nevada Health District. I think that's really helpful and also in line with the spirit of what I'm going to say. But we had a conversation early on about, the purpose of this task force being to open things up with the goal to keep the spread of COVID-19 contained. And we had a very specific conversation about this idea that as we open things back up, we do realize that more cases are going to happen and transmission is going to increase in our communities. But the goal was always to be able to mitigate at such a level that we don't reach our previous peak or get to a time where we're back to where we started from, which is where we are today. And the reason I say that is because we had a conversation that talked about, as we go through this process, we're inherently going to learn about what levels of mitigation we need to keep as a sort of baseline going forward. And the way that we learn that, similar to how we're learning, from COVID in the science arena, is trial and error, right? So we make a decision to close something down, we see the data respond to that. We make a decision to open things back up, we see the data respond to that. I just want to draw attention to the data because I think now is the part of the conversation where that becomes meaningful. We have seen that going through the steps that we've gone through to date to open up the economy, we do not have a sense of control over COVID currently in our communities, which was our goal. Our goal was to do that and slowly and steadily and in a way that we could not get back to where we were. And the reason I just wanted to make a comment now is because at this point, we are back where we were and we do not have control over COVID. And so I think we do need to take a big look at what we're doing and what was working for a period of time and what we've done since that has not allowed us to maintain the sense of control that we had previously.
It's an extremely important point, and one that I think allows us to, the other purpose of this task force was based on the request from local governments to have a say in the overall process. And I'll say up front right now, I think Clark County probably has the clearest, most data-driven and aggressive position on all of the mitigation measures and control measures that are necessary, increasing testing, decreasing events, coordination between local governments and so on. And they don't have surging hospital, well, they have surging hospital capacity, but their hospital occupancy is not even as high as it was at this time last year. So they still have a little breathing room. However, the numbers are growing, and it's more than believable that breathing room will disappear in the weeks ahead, and we may wind up in the situation that we have in Northern Nevada, in Southern Nevada as well. So the things that we know that work are wearing masks, personal hygiene, social distancing, not going out when we have to. And that's really what has put us in the position right now to be able to have that's what's put us in the decision right now or the position right now for the governor to have to make the announcement he did on Tuesday to say, hey, we got 2 weeks to get this under control, or we're going to have to take critical statewide measures. And so I'd like to open it up to other members of the task force right now and see what your perspectives are on that. Now that we've seen, we've got Clark County's presentation, we've got 7 more here, and we need to get to Kyra's presentation here momentarily. But based on that very important point that Kyra just made, what are the thoughts and concerns and desires of the rest of the task force, given that we have this timeline right now?
Kayla, this is Lieutenant Colonel Brett Thompson. I just like to commend Clark County for their data-driven matrix that they have. I know we've all read through the different counties and their plans that they will go through today. Some have those, some do not. I do think that that might be a standard that maybe we would like to ask the counties to utilize. It is allowing Clark County to make those hard calls in a very transparent way, which I think the public would appreciate seeing. That's all I have.
So, Colonel Thompson, explain that to me a little bit. What component of Clark County's plan are you suggesting we see in other plans?
So I'm looking at agenda item 5 Bravo and the plan that was discussed, green, yellow, and red, and they have a very well laid out what they are evaluating, what color level that translates to, and then what that translates to as far as a recommendation. So there is no question of, like Misty just said, are we going to approve these or recommend approval or not recommend approval? It's a simple graph. And if your numbers hit these things, then you are either a green or yellow or a red, and they will either recommend or not recommend appropriately.
Okay, thank you. I just wanted to clarify because they had a number of things in there that I thought were pretty interesting. But yes, that having the Southern Nevada Health District 5B or 5 Bravo component that Misty was talking about be a part of the Southern Nevada plan, which it is essentially, but combining that in, I think is a helpful step right now, and it shows local ownership of the issue overall. We've seen that in a similar version of that in Washoe County as well, where they've put a limit on the number of people who can get together in general, which is basically which has in effect removed the large gathering plan as well. That I agree. That's the sort of thing that I think would be extremely beneficial statewide. How about anybody else?
Caleb, this is Terry Reynolds. Just to amplify what has been said here, we really agree with what the health districts are doing and the limitations that they have they put on events. And so we respect those limitations, and we do not approve of them of events that we receive when the health district does not want to approve the size of the event. So we have them scale back to coincide with the recommendations of the health district. And I think that's very appropriate. We have weekly calls, as you know, Caleb, with the health districts, and we're essentially in sync with making sure that we're not doing something that would be contrary to what they feel the public health safety should be. So that's where we're at with that. I just wanted to bring that up.
Thank you, Terry. I appreciate that, Director Reynolds. Yeah, that's good to know, right? If there are multiple layers of review, the health district is not going to be overridden if they're making recommendations to not approve at this time. I think that's very important to understand as well. Other comments from the task force or any interest for action regarding Clark County's plan as submitted? I'd like to go ahead and make a motion to approve Clark County's plan as written and as proposed, with the modification that when updated for next week, the Southern Nevada Health District 5B portion regarding approving large venues and large occupancy events be included specifically in the Southern Nevada Health District Plan, and that those two things carry forward. I know they're associated. It's probably a foul up based on the agenda, but I just want to make sure that those two are reviewed together. So the motion is approve Clark County's plan with the expectation that next week the Clark County and the Southern Nevada Health District plans would be part and parcel of the same. Is there a second?
Hogerson, I'll second.
Thank you, Dave. Any discussion on the current agenda item at this time? Hearing none, all those in favor, please signify by saying aye.
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 Any opposed, vote no. Okay, great. Thank you, Clark County. We can follow up with you and have this discussion. I know there are a number of things that we need to work on from our end. Appreciate the reminder on the COVID trace and the discussion regarding skilled nursing facilities and hospital patients. We'll follow up on both of those. This time, I'd like to turn it back over to Kyra and Julia to provide the overview for where we stand this week, and then we will go to Carson City next. My apologies for missing this opportunity earlier on the agenda, but please go ahead, Kyra.
Sure, I'll just give a second to get the slides up. Thank you. So we could just go ahead and, sorry, this is Kyra Morgan, the State Biostatistician for the Department of Health and Human Services. We can skip into slide 3 and jump right into the data here. And then I'm going to go through today and also provide comparative numbers on some of this information for last week's task force, just to really show the magnitude of change that we're facing right now. Over the last 14 days, we're averaging 969 new cases a day. Last time this was presented a week ago, we were averaging 679 new cases a day, so dramatic growth there. Our case rate over the last 30 days as a state is 796. Last time we presented, it was 612 cases per 100,000 over the last 30 days. Our death numbers are starting to increase. You'll see more about that on the next slide, but pretty consistent, averaging 5 Nevadans dying from COVID-19 on a daily basis over the last 14 days. And then testing numbers on the far right showing 295 tests per day per 100,000 residents over the last 2 weeks, and a test positivity rate of 13.8%. Really, the story here is still just showing a significant increase in trends over time. And then there's more details on that in the next slide, which shows those trends for new cases and deaths. So if we can go to the next slide. You can see here, really the scary part is that the right-hand side of that first trend line, just the really steep growth that we're seeing currently. We have surpassed daily cases that we were seeing in the worst part of the pandemic to date, which was back in the end of July, with over 1,600 new cases diagnosed on a single day just about a week ago on November 5th. And those data are still coming in, as you know, based on test turnaround time. Sometimes we do see more than a 7-day delay, so those could still grow a little bit there. So again, the takeaway here is that we have officially surpassed our previous worst point in the pandemic with where we are now, and then just the slope of that blue line on the first chart at the very end there, eliminating the last couple of days that are incomplete, you'll see take a really steep turn and just show a really fast pace of growth. The daily death charts at the bottom also shows that we have kind of hit a turning point there. We had a low at the end of October, beginning of November, and as expected, we have seen deaths start to increase slowly, and I anticipate in the next meeting we'll see that go up even further. Going on to the next slide, and I know we talked about hospitalizations a lot today, so this is just a quick snapshot that we include weekly in these presentations, just showing the overall hospital trends. The last numbers that we have here were as of the 10th of November, when 796 confirmed and additional 154 suspected COVID-19 cases were hospitalized in Nevada. I did include another slide, if you go to slide 6, to break that out for Northern Nevada versus Southern Nevada. Could we get the next slide, please? And really what this shows is something that we had not seen in our previous peak, which is the steep growth that we're seeing specifically in Northern Nevada. Here, Northern Nevada is defined as Carson City and Washoe County. And so not to say that Southern Nevada isn't on a rise and having issues in the South as well, but a stark contrast in Northern Nevada compared to what happened in our last statewide peak, which is really showing kind of a different behavior in the northern part of the state than what we have seen yet, which is pretty concerning to me. And then going on to the next slide, jumping right into test positivity rates. Again, they just continue to increase. Here you can compare our previous peak in July and August to the 13.8% positivity that we're seeing over the last 14 days. And we're not quite to where we were, but we're getting pretty close. So definitely a bad sign there. And we don't have an indication that that trend is starting to subside or take a turn. I anticipate that it continues to grow based on current data. The next slide looks at test turnaround time. So this is fairly generic at this point. We go over this in most meetings. We're still averaging 2 days as a state, but we do see pockets that are taking longer. Specifically, I see some pieces of the grid up to maybe 9-day turnaround. And then the next slide I've added to this presentation today for the first time based on conversations last week, really just showing the proportion of tests statewide and how long it's taking to get those completed. And so the interpretation here, for example, would be that 39% of tests for COVID are being returned in 2 days, 24% statewide are being returned in 1 day, 18% statewide being returned in 3 days, and so on. And then the table below really does draw attention to some of the disparities in some of our rural counties. So you can see similarly to the chart on top, but at a county level, you can see the average is highlighted in the darkest shade of yellow. I shouldn't say the average, the most common turnaround time is highlighted in the darkest shade of yellow. And then you can see where the outliers lie, a really broad range in Douglas County, for example, and Mineral County, with some tests, up to 5% being resulted in 11 days, which is really, I think, the areas that are drawing concern. White Pine also looking very disparate there as far as taking a longer time to get their results. So I'm happy to answer any questions after the presentation about this specific slide. I know we haven't seen it before and it does contain a lot of data, but hopefully that's helpful in identifying some regions that are maybe being affected more than others as far as getting people their results in a timely fashion. And then the next slide, slide 10, jumps right into the county tracker. This is our comparative slide for last week, which was November 2nd. And then moving right along to slide 11, we could see results as of Monday, putting, looks like 10 of our counties as being indicated as having elevated disease transmission. And it looks again like all of those counties are being flagged for a high case rate, meaning that they've had more than 200 cases per 100,000 residents in the last 30 days and a high test positivity over the previous 2-week period. Eureka is actually flagged as having insufficient testing rather than a high test positivity rate. And then it looks like Lincoln and Nye are being flagged as having all 3 criteria not being met currently. Going down to slide 12, we could see how these trend over time. So here, testing per day per 100,000 really doesn't seem to be a driver of flagging these communities. Again, we did have a couple of counties flagged for having insufficient testing. Overall, this is not driving what's getting counties to make this list. The next slide, slides 13 and 14. 13 is for the number of cases per 100,000. And you can really just see drastic digression in progress here from mid to late September to where we are now. Almost every county, with the exception of Esmeralda, Pershing, and Story counties, are now showing a high case rate, which is indicative of pretty severe community transmission. And then a high test positivity rate on the next slide, slide 14, for a number of our counties as well. And again, just graphically, you can see here, where we've been through mitigation efforts through the end of September. Things were controlled very well at that time, and then we have slowly kind of released some of those mitigation efforts, and you can see the progress kind of back towards where we were earlier in the year. And then again, as usual, just trends on the bottom of the screen for any specific county, if you're interested in those. Interesting here to see Washoe kind of have slower but consistent growth, whereas, you know, Carson, we've seen very, very drastic progression in the wrong direction over the last couple of weeks. And then just based on public comment today, I realize I don't have contact information here for the Office of Analytics, but I'll add that next slide. Data can be requested from anyone related to COVID-19 by just emailing data@dhhs.nv.gov. And so I'll include that going forward so folks know who to ask for more specific information into the data that we go over in these meetings. And with that, I'll just open it up or pass it on to Julia.
Let's go to Julia right now. The data at dhhs.nv.gov is also on the dashboard. Do I remember that? So if they need to find it, it's on the public-facing dashboard at nevadahealthresponse.nv.gov as well. Let's go to Julia.
Perfect. Thank you, Chair. So we've now identified a total of 28,671 of our cases through our traditional case investigation and contact tracing efforts. We've really remained steady. It's about 25% of our cases reported to date. I don't see us getting much fluctuation, honestly. It means that 75% of our cases still remain as general community spread. The 25% means that we were able to link cases together, a case identified another case. So related to the 75% of the cases that are not linked to a specific case, we have developed, as you all know, and we've talked about at this meeting, the COVID Trace app. I'm happy to say that through a variety of promotional events, we're now at almost 80,000 downloads. As of last night, we've had 25 of our cases that had the app on their phone at the time of their diagnosis. And as a result of those 25 cases, we've had 21 exposure notifications sent out via the app. I again just want to encourage everyone to download it. It's a totally confidential tool that allows you to just track your potential exposures and then personally take action based on that information. We do have an agenda item coming up later looking at some challenges related to our case investigation and contact tracing. I have some comments related to that. I can make those or I can save those for that specific item, Chair, at your discretion.
Let's go ahead and stay on this agenda item right now, and we'll go to agenda item, I believe it's 8 when the time is right for that. So thank you very much. Open it up to members of the task force at this time. What were you complete? I'm sorry, Julia.
End of report. Yep.
Thank you very much. So I'd like to open it up to the task force right now for questions or any follow-up to either Kyra or Julia on their report.
Hi, Mr. Chair, this is Dagny Stapleton. I just had one thing. I wanted to thank Kyra for the addition. Well, two things actually. First, I wanted to thank Kyra for the addition, slide 9, that breakout by county of the test turnaround time by day, by county. That's really good information, and I think helps with the discussions that we've been having about test turnaround time and helps us to understand that better. So I really appreciate that. And then Mr. Chair and Kyra, if it's all right, I think Washoe County had a question on this that they wanted to bring to the group. I think Kevin Dick, if he's on, if it's all right, Mr. Chair.
That's fine. And Mr. Dick, if you're on, please either unmute on your phone or *6.
Yeah, thank you, Chair Cage. I am on. I wanted to explore the data presented on slide 9 for the testing turnaround times, and because it doesn't seem to align with what we're experiencing here as far as able to obtain results from the NBS system. And so my question, I guess, to Ms. Morgan is, are these the times that the tests are reported by the lab through the state's secure FTP site? Because I think there's potentially a 2-day delay from that period until it actually comes through to the local instance of NBS where we see the lab reports.
Thanks, Kevin. This is Kyra. No, there's a field in NBS, I'm getting in the weeds a little bit, which is the added date. So that's typically the date it's added to the NBS system. So these data are actually pulled through a front-end report through NBS and have nothing to do with the FTP process. So at a state level, these data are truly looking at, we pull these directly from NBS, and the calculation is the difference between the date the specimen was collection and the date that NBS calls the lab added date, which is the date it's added to our electronic system.
Okay, and is it then immediately available for the locals when it's added there, or does it take another period of time before it appears in our view, the local instance of the NBS?
That's a good question, and that I don't know the answer to. I don't know if any of my colleagues on the phone do, but I could definitely do some research and get back to you.
Kyra,
okay,
Kevin,
and maybe I'll have Ms. Kerwin get in touch with you as well to explore this.
This is Julia. I'll add that, Mr. Dick, we already reached out this morning to Ms. Kerwin, so already looking into if the issues, the different instances, but we're tracking the labs through the system to see where there could be potential delays. So we're already on that.
Excellent. Thank you.
Thanks for your question, Mr. Dick, as well, and for all of the feedback. Earlier this week, we did have a lengthy conversation, and I'm gonna take those 2 slides that Kyra provided this morning that Mr. Dick called out, and add that to the overall memo that walks through this entire process and looks at the time delays or not time delays, but the potential amount of time in each one of those segments of reporting, because I think one of the things that we know is the 2-day average that we're reporting. Again, it's an average of 9 in some instances to less than 1 day in other instances, does not meet the local level experience. And we're working on a number of those to first get our arms and our minds around that, but also to identify some of those solutions. So I look forward to updating you on that as well. Any other questions or comments from the task force at this time regarding those 2 presentations?
This is Megan with Branson. I don't have a question, but I want to thank both Julia and Kyra for all of their hard work and always being so accessible. It's really valuable and how transparent they are throughout this whole process. So thank you both.
Thank you, Megan. I appreciate that. Without any other comments, what I'd like to do is to continue on with this agenda item right now. And as I noted earlier, we started with Clark. I'd like to go to Carson City, and I think I saw Ms. Aker on. And if you or a member of your team could give us, again, just 2 to 3 minutes on status and any changes to your plan based on the current situation going on in Carson City at this time.
Hi, Caleb. It's actually Nancy Paulson, Carson City Manager, and I'll be going over our assessment plan.
Great, Nancy. Thank you. Go ahead.
All right, just to start out with, Carson Tahoe Hospital, confirmed and suspected COVID-19 positive patients that have been hospitalized have doubled in each of the last 2 weeks, and that's greatly impacting overall hospital operations. As of November 3rd, the hospital has canceled all elective surgeries, and the hospital has also reopened the State Disaster Medical Facility tent for triaging emergency department patients. On testing, the city continues to test at our health department daily, with symptomatic individuals having priority. During the week of November 1st to the 7th, we administered 279 tests. As far as community-based testing, in the month of October, we held 4 events and administered 970 tests. In an event on November 6th, we administered 356 tests. So the numbers are definitely increasing in individuals that want to be tested. For case investigation and contact tracing, we're seeing the most common exposures are contact with another COVID-19 case. That accounts for 52% of our positive cases. In the schools, the health department continues to work very close with the schools for contact tracing. Our school transmission, thankfully, has remained relatively low. And we'll continue the partnership with the school district and working with them to implement mitigation strategies and tracking cases. On enforcement, complaints related to compliance with the governor's directives are received through our COVID-19 hotline and the health department's Facebook page, and they are directed accordingly for follow-up to either our health inspectors or to OSHA. We'll continue to monitor all violations of the directives, and if necessary, we'll follow due process to address the violations. And then on our action plan, we are focusing on community education. Both the health department and through the city manager's office, we've created and distributed community education on a variety of COVID topics. We've done a big banner across Carson Street that promotes the wearing of masks, and we've engaged the Latino Leader Academy at WNC, and they did a PSA that was translated into Spanish for us. Later today, we're working on a press release to inform all the residents of the governor's most recent stay-at-home 2.0 guidance, and we're going to be working on several PSAs in the next couple of weeks just to reiterate the guidance and to stay at home and wear masks. As far as city operations, we continue to diligently implement policies and procedures that are in compliance with the governor's directives. We have our departments reducing their in-office staff where the employees can work at home, and those that remain in the office are required to wear a mask at all times unless they're in their private office. We've canceled community events for the next 2 weeks, like ribbon cuttings, and we are limiting staff at board and commission meetings and encouraging everyone to participate by WebEx. And large gatherings, we've pretty much the whole pandemic, we've been not approving any street closures for special events. We do that a lot in Carson City, but due to the inability to ensure that the COVID-19 directives can be met, we have not been doing that. We're also reviewing special event permits on city and private property for compliance with COVID guidance. And we're in the process of finalizing a checklist for special events and gatherings to facilitate event operational plans. On the flu outreach, we're continuing to offer the availability of flu vaccinations to the public. And we're doing this as combined events, which offer both COVID testing and flu vaccinations. Our testing plan will continue to be implemented. We have not had really any issues in meeting this criteria. Our testing is always well above I think it's 200 or 100, I'm not sure. We're also researching another option with our local hospital for specimen testing due to the length of turnaround times that we're seeing. And I agree also in looking at that chart, it didn't seem to match what we're seeing at Carson City as far as turnaround times. We have the National Guard's been integrated into our monitoring process for our positive cases, and we're working on hiring 3 more part-time disease investigators and administrative assistant to assist with the data entry. PPE, the city's continuing to distribute PPE and sanitation supply to our businesses. And just to ask for state or any state or federal resources, if we could get an extension of the National Guard past December. And I don't know how much pull you guys have on this, but if we could get an extension of the CARES Act funding deadline, which is right now set for December 30th, that would be great. That's the end of my report.
Thank you, Nancy. This is Caleb. On your last 2 comments, I think those are ones we had a conference call on this morning. National Guard support beyond really mid-December, a month away at this point, as well as CARES Act expenditures. There's going to be a lot of federal discussions on that, and we're pursuing all of our options to make sure we can make those requests and seek approval as well. So thank you for including those. I'd like to open it up to members of the task force right now and see if anybody has any feedback regarding the assessment or plan from Manager Paulson in Carson City. So from my perspective, I think that I guess I have a couple questions. Nancy, if you don't mind me calling you Nancy, sorry, Manager Paulson, you mentioned a checklist for large events that you were approving as a part of their mitigation plans. Just clarifying, because we heard what Clark County was doing as far as red, yellow, green, for approving different levels of sizes of events and so on. Is that the type of checklist you're talking about, or is it kind of a planning guidance checklist? As in, this is how to have people at 6 feet social distancing and make sure you're providing for masks, et cetera.
Yeah, it's more of a planning tool. We were just talking about that. That we did like how Clark County was doing that with the different colors. Fortunately, with Carson, we don't have that many large events going on. So yeah, right now it's just what they need to do to follow, to be in line with the governor's directives when they're having a special event. And a lot of it came from, I think, when the governor sent out that latest information on large gatherings.
Thank you very much for clarifying that. I'd love to personally just to see a copy of that when it's done, but that's just for my own curiosity. I think someone
Chair
else
Cage.
was going to, yeah.
Yeah, this is Nikki, for the record, Director of Carson City Health and Human Services. So what we did is we took the checklists for large gatherings, and because Carson City will not really have any large gatherings, we modified that list to use for the larger gatherings that we would have. And then using that as guidance as people plan their events so that it can be done safely.
Thank you, Nikki. I appreciate that clarification. Other questions from members of the task force? I guess the one thing that stands out to me, Manager Paulson, is I think you opened, and it's in your report here, but you opened by saying over the last 2 weeks and the 2 weeks before, I can't remember exactly how you phrased it, but your hospital capacity has doubled twice over the last month. It may be a way of saying that. And what we saw earlier with Carson City and as a part of the Northern Nevada numbers, we're clearly seeing a case increase in Carson City, hospitalization increase in Carson City. And I guess one of the questions I would ask is, do you anticipate the mitigation plan that you've provided today to get the community spread under control in the next couple of weeks? Are there mitigation measures that you believe could be included that are not included? Or are you kind of waiting to see, and I don't mean that in a derogatory way, but you're waiting to see what the governor's decision is in 2 weeks as far as any sort of increased mitigation measures are concerned?
Not sure if we lost Nancy. So this is Nikki. I would say that with our plan to provide public education, especially on what the governor put out just the other day, that I'm hoping that by getting that information out there and what it means to our residents, that people start taking it very seriously and we can start seeing a decrease.
Okay. I do appreciate, and we're working on public information as well. And of course, the governor's press conference was a big step forward in that direction. The one piece in your plan that I would modify, let me make sure I see it. The one piece in your plan that I would modify, or I guess the two would be, I think adopting something like Clark County's event planning schedule, rubric, whatever we want to call it, their matrix for determining whether or not those certain conditions have been met, and if large events can be approved. I think that's a great, I really think that's a great focus that they've done. I think that based on your understanding, or your presentation rather, that Carson City doesn't really have a large number of events. That may be just a tool to develop and continue to refine. The one part that I see in the plan that is concerning to me is, and I'm trying to find it right now, the enforcement plan is essentially, it says it's really, let's see, Carson City has authority over business licenses, special events permits, and uses of city property. Carson City will continue to monitor violations and if necessary to follow up and restrict these authorities. And I'm trying to find the part in here that said, I apologize, that really focused on, education to establishments instead of enforcement measures, but I maybe have that wrong. Can you give me any insight into that?
Sure. It looks like Nancy got hung up on.
Page 14 at the bottom. I'm sorry, that's the part I'm referencing. It says, in reference to compliance rates and enforcement actions, a specific number cannot be provided as this information has not been tracked because CCHHS Environmental Health takes an educational consultative role. Any issues outside of CCHS Environmental Health Authority is forwarded to OSHA. So I guess what I'm asking, I'm sorry to clarify a little bit more, is that two-sentence statement saying we're not doing any sort of enforcement in terms of licensure. We're educating when we find any sort of infraction or people not following the rules, and otherwise forwarding to the state. That seems to not be the case, and I want to make sure that's clarified.
So if it's a food establishment, let's say, that our environmental health can address, and they're not following what needs to be followed, they on the first go round, they will be very educational and provide teaching of what needs to be happening. Of course, our environmental health folks have a certain, they have a regulatory to a certain extent. And so if it impacts the food safety, then they can cite and do a violation. But now if our health inspectors say a retail establishment, our health inspectors do not have jurisdiction over our retail. And so that is where, if there is a complaint that is turned in for our retail, then that complaint will be followed up and forwarded to OSHA.
So I guess that does helpful. That is helpful. Thank you. So is there a business licensing component as far as enforcement is concerned? If it's retail, they'd have a business license through Carson City, I'd presume. And I know that there's a spreadsheet here of some facilities, but is there a collaboration with the business license enforcement procedures as well?
Yes, there is a business license, and hopefully Nancy's back on so she can speak more intelligently about that piece of it. Guess she's not back on. So yes, there is a business license.
I am back on, Nikki.
Oh, you are good.
Yeah, sorry. Sorry, I went to unmute myself earlier and it hung up on me for some reason. So yes, we definitely have where we can suspend business licenses and go down, you know, that road as is necessary if the, you know, violations continue and are not and businesses are not following the governor's directives. That would come under our code enforcement department.
And do we have any, do you have any examples of that happening, or is it mostly done through seen through the environmental health?
Through environmental health, or if not, it's, you know, it's gone specifically to OSHA, but I don't know that we've had many calls for violations in some of these, in the other businesses.
Okay, so one of the ways that we've addressed this in other communities is so I'm seeing two challenges here that I'd like to see addressed in the plan. And the first is a comprehensive, coordinated approach between all of the enforcement mechanisms that allows the contact tracing, the hotline, and other elements to drive the enforcement model. And for there to be sort of a task force approach. We see that in Washoe County has stood up a task force. Clark County has stood up a task force as well. And within that task force, there's a number of layers, and we can get you, I'm sure we can, well, it's all public, so we can get you Washoe County's model. But basically, there are two components that I would need to see to feel like the enforcement methods are actually going to be effective to capture the accurate number of instances that are going on in the community. The one would be that there's a structure internally, and Director Reynolds, I'll defer to you on what this should look like, but there's a county city structure internally that says these are our agencies, this is how often they meet, this is how they take information in, how they triage the information or share the information between different enforcement mechanisms. And then the second piece would be a list that says first infraction is is it a conversation, an education, go back and there's a second infraction. And we know from OSHA's engagement that the numbers go from 80 to 99% on second visit. So we're seeing the same thing. But what happens in that case? Is there a specific policy that says that the license is restricted? Is there a fine? Those sorts of things as well. Director Reynolds, is that something that is? Am I not seeing something that's already there, or is that something you see as a potential improvement of the plan as well?
Caleb, this is Terry Reynolds. I would agree with what you just said. I think that there could be some focused effort between Carson City and the health department. I know the Carson City Health has been on our calls, and they're familiar with what's going on within Washoe County and the work that Reno and Sparks are now doing to get out and do inspections. But I think that helps us. Frankly, really the areas that we see the most complaints are within Southern Nevada and Northern Nevada and the Reno Sparks area. We do get complaints in the Carson City area that we do follow up on with that, and we have cited businesses within the Carson area. But I would suggest that there be more of a concentrated effort between the health district and the city, in terms of getting out and getting inspections. I know it's difficult in terms of freeing up staff and being able to do that in a timely manner and dedicating resources to do that. The other thing that I think you're aware that there has been a large outbreak in Warm Spring Prison, and the numbers have actually gone up dramatically because of that. I think there was almost 100 individuals that tested positive within there. Those figures are in their report. So, but I think that we are working very well with Carson City entities, but I think they could concentrate more on getting out and doing inspections, and that would alleviate the time and effort that we have to do that, and we can coordinate on those businesses that are not following through. But generally, I think there's actually fairly good compliance within the areas, but I think that they could concentrate on getting out and doing those inspections as you've indicated.
Thanks for that, Terry, and thank you for bringing up the Warm Springs facility. That should not be overlooked. That is a significant increase, and as we all know on our excuse me, road to recovery plan that we operate by, that we've created there's space in that plan for us to identify surges within state facilities, regional concerns, relationship with tribal partners and tribal lands as well. So thank you for bringing that up. I guess, are there any other questions from members of the task force at this time? So, Ms. Paulson, Ms. Aker, I guess one of the recommendation that I'm going to make now is that we approve this plan with two caveats, and one is that we develop, you work with state business and industry, any other county partners that already have a successful model on enforcement underway to work towards a integrated task force approach. And then for us to see if, as far as the plan approval diagram or proposal that Southern Nevada Health District put together, to include something like that in your decision-making process for large events as well. And so would those be acceptable to you as next steps in refining this plan going forward?
Yes, and then I had one question, and maybe someone at the city gets it, but I just don't see it. Do we get reports of the businesses in Carson City that OSHA has gone out to and there's violations? Does the city get those reports?
I know that they are on the dashboard. Terry, Director Reynolds, I'll defer to you.
Yes, Caleb, we have, if you go to the department or the Division of Industrial Relations, OSHA, or just Google OSHA on there, it'll take you to the dashboard, and the dashboard is broken down by city, also by zip code area, and then you can go to each section of industry and see what the compliance ratios are. So we can, I can send you those links if you'd like. Happy to do that, but it's very easy to keep track of and follow through and look at what's happening within each community throughout the state. It's also updated by Thursday of by today of every week. So it's very timely.
Okay, thank you. I don't need the links. I think I can find it.
Okay.
Great, thank you very much, Director and Manager Paulson. I'd like to go ahead and make a motion right now that we approve Carson City's plan with the caveats that next week we'll come back and have the enforcement component of the plan built out as either a task force approach or a city and health district approach that shows all of the pieces we talked about earlier, and as well as a decision-making guide for approving events, large events, public events, community events, et cetera, for Carson City. Is there a second?
Caleb, this is Terry Reynolds. I'll second that motion.
Great, thank you, Terry. Is there any discussion? Okay, hearing none. All those in favor, please signify by saying aye.
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 Any opposed, please vote no. Okay, motion carries. Thank you, Ms. Paulson and Ms. Ager for being here. I know a lot of work has gone into this. So at this time, I'd like to continue on with the agenda and see if we have any representatives from Lincoln County who are on right now. Anyone from Lincoln County who is on right now?
Sorry about that. I was muted and trying to figure it out here. This is Eric with Lincoln County Emergency Management. How you doing?
Hey, Eric. Doing good. Thank you, sir. How are you?
Doing good. So for a overview of our assessment and plan, like many other counties in the state, we have seen a significant increase in cases over the last 3 to 4 weeks. For the first 6 months or so of the pandemic, we were fortunate and had not seen a significant number of cases. But we recognize over the last 3 to 4 weeks, we have an increase, and as a result to that, we have increased our testing through our county or our hospital clinics. We've also increased our transport of the tests daily to Las Vegas. And so we are testing approximately 60 to 150 people a week. And out of a county of 5,000, we see those as fairly decent numbers. We're also continue to educate and inform the public of the importance of social distancing and sanitization, limited travel, and those things through social media and the newspaper. We are continuing to keep tabs on our PPE levels and keeping those in check. The county commissioners several weeks ago made their enforcement stricter of masks at all time at the county government offices when in contact with any public. And then the testing right now, our testing levels are meeting the demand of testing, so we don't have any shortage of being able to test those who want to be tested, and we're continuing to encourage the members of the community to be tested. We are considering more days. So currently we test 3 days a week, Monday, Wednesday, and Friday, and there's certain hours that they are performing those tests, but currently, our testing is meeting the demand, so we'll keep tabs on that. Our contact tracing, our county health officer has done a good job of continuing the contact tracing and been able to identify, groups of high transmission rates, high concentration groups of transmission rates, and some of those, have been identified, and we are addressing that directly with those entities or groups. Just to name a few, the State Youth Center has been part of that. One of the churches, one of the elementary schools, and the hospital. So we have been able to capture that early through the contact tracing and put in mitigation measures there. And I want to note that those entities are responding well to that, as some of the church and a restaurant self-closed for several weeks due to concerns there. So the response has been good. However, we, still have a challenge of elevated cases. So I spoke with our hospital administrator, and she's concerned and taking it very seriously, as are most of us. We have an assessment meeting planned, or in process of planning, with our hospital administrator, the health officer, our commissioners, and the Office of Emergency Management to do a focused assessment and identify future mitigation moving forward. And then also from our office in Fire and Emergency Management, we will be hiring a program coordinator to help with the added workload of COVID here. With this, I'll take any input or questions, and that's the end of my report.
Thank you, Eric. I appreciate that. So you have, just to make sure I'm clear and reading through your presentation here, you have a total of 46 cases that are active, the majority of which are quarantining and just recovering without medical help or medical intervention. One individual who's in acute care right now as well, and your group is meeting here, I'm guessing in the near term, in order to develop additional mitigation measures. Would we be able to, assuming Lincoln County is included next week as well, would we be able to see those mitigation measures as a part of next week's plan?
Yes, absolutely.
Okay.
And that is correct on the numbers that you read off, to my knowledge.
The based on your report here, the low number of cases, and I know that it's lower population overall, but we've had this discussion before with you, and seeing the increase in testing, the mitigation measures that you have in place out there. I just want to first of all say thank you for your continued input. Do the members of the task force have comments or questions regarding this plan or any input at this time? Okay, I'm not hearing or seeing any, Eric. What I'd like to do now is make a motion to approve Lincoln County's plan with the caveat that next week we see the outcomes, any additional mitigation measures that the county has in place in next week's plan. And Eric, I'd love to maybe you, me, and Julia, and whoever else from the county would be available, maybe NACO as well, to meet on Wednesday of next week, just to make sure we're all on the same page, and if there are any needs or anything like that, to make sure we're all on the same page ahead of next Thursday's meeting, if you're open to that.
Yes, that's agreeable.
I think I was in the middle of a motion, so let me start over. I make a motion that we approve Lincoln County's plan with the caveat that next week they'll provide us their comprehensive mitigation plan for their increased caseload at the local community level. Is there a second?
This is Richard. I'll second.
Okay, thank you, Richard, for seconding. Is there any discussion at this time? Hearing none, all those in favor, please signify by saying aye.
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 Any opposed, vote no. Great, thank you. Motion carries. Would like to continue on with go to Humboldt, Lyon County, then Nye County next. Do we have anybody on the phone from Humboldt County who'd be able to present? Okay, great. What I'd like to do, we really need representatives from county governments to provide input on this. I think Humboldt's cases are well described, and their jurisdictional action plan is well considered. Their graphics showing their case rate climbing is significant and of concern. We're not going to get anywhere on this unless we can have some conversation with Humboldt County as well. I'm going to move that we do not approve. We reject Humboldt County's plan and invite them to present the plan again next week and have a further discussion at that point. Is there a second from any member of the task force on that at this time?
Chair Cage?
Yes.
This is Dave Mendiola, Humboldt County.
Hi, Dave.
I turned you down for a moment. I'm not sure how we jumped clear to Humboldt County and you bypassed me.
Sorry about that. I'm glad you're on, Dave. You want to walk us through your plan?
Chairman Cage, this is Humboldt.
And have a further discussion at that point. Is there a second from any? I hear Dave Mendiola on the phone and someone else calling in from Humboldt as well with a lot of background.
Yeah, Dave Mendiola. There he is. Okay, thank you.
Dave Mendiola, Humboldt County.
Chair, if I may, this is Randy Brems. Somebody is playing the task force meeting in the background, so we're getting some feedback echo. Can you please turn down the task force meeting in the background or mute your phone?
Thank you, Randy. I appreciate that.
Thank you, Chair Cage. Dave Mendiola, Humboldt County Manager. So I just wanted to start with our assessment summary for our jurisdictional report, and Humboldt County has been flagged, obviously, for elevated disease transmission. And we were reported 8 more cases today, so we've got a total now of 215 to date. As of November 10th, like I said, we've accumulated 215 cases. Let's see here. Currently, that'd be 33 cases are active. 4 people have died. We have not had a death in many months, so that's very good news. Also, just to add the Fort McDermott Paiute Shoshone tribe, they've got a total of 113 cases. That might be up today, up a little bit today, but I haven't gotten that updated report. In all, 108 people have recovered, 4 cases are active, and 1 person has died at the Fort McDermott Shoshone Paiute tribe. We are seeing our highest positivity numbers to date, and while many cases are tied to travel and small gatherings, the county has seen a few high instances of community transmission now. What that really means is that it's under investigation, and there are a number of cases where we really can't track it to any specific event or gathering or anything. People are just saying, I have no idea where I got this. I haven't really been around people. So those are, concerning, but as we know, we don't always get clear and truthful information from folks, so that could be different. But I do want to point out that unlike, much of the reports I've heard from Clark and others, we have not ever during this process been able to track anything to a public event, whether it's a bar, a restaurant. We've had a couple of large gatherings here. They were outdoors. We have not had one case come out of those. And we've watched those really closely with our contact tracing, primarily because we were concerned about those and had real, doubts that we could possibly go through something like that without an outbreak, but we didn't. So I'm not sure what that says, but so a lot of what our concern is from the state's perspective, the governor's perspective, is a focus on shutting down businesses is just not good business, because again, we can't track anything to businesses or to public events. So the good news is we're into the winter months now, and so there are very few large gatherings, if any. I have contacted our local convention center folks about anything that they're doing. Again, we don't have much going on for the rest of this year. So we don't have anything to worry about there. In the springtime, when that comes around, that's a different story. Got some a big indoor rodeo and things like that, but that's out until March and April. So, but also wanted to mention that during October, we had an average of 1.5 cases a day, which was a significant increase from March and April, which was about 1.32 cases per day. So far, our county is averaging 2.9 cases here in November. That just went up today with the additional 8. So we have seen significant increases in cases among adults, especially the older adults in their 60s, and also in teens and children. So hospital occupancy rate for both general and intensive care beds remains really good. No ventilators are in use and no COVID patients are hospitalized locally. And the status of PPEs is very good. Had a meeting today with our emergency management Captain Wilkin, and all is good on that front. We're in great shape. The hospital met with the CEO, CFO last week. They're in great shape for PPEs. They're also have really got a good process and going on in the hospital now, so have had no issues of exposure inside the hospital, so we're in really good shape there. As far as our plan going forward and our action plan, so the main thing is since the inception, we've taken appropriate measures and actions, I think, to prevent the spread. We are experiencing the second wave like we've heard about and are hearing about all over the country. And so we are really focusing on a number of efforts through our county health board, which is essentially a multidisciplinary team of emergency management government leaders, our medical office manager, Dr. Stringham. And the board's going to continue to successfully manage the cases and assess the resources within the county that we need. So the one concern we do have, like I've heard from others, I heard the CARES report on the quick turnaround time, and we are just not experiencing that at all. So I do have questions about that. We have turned to a different process. The hospital is currently testing a project with Quest Diagnostics, and we're also working with LabCorp, and we are getting early results so that we're getting those things turned in less than 48 hours. So our thought is we're probably going to go to that because I have a personal experience. I had some illness, got tested, and it took me 10 days to get the results back. So, and that was just recently. So, and we had been hearing that, but I had a personal experience with it. So it's still happening out here with respect to Humboldt County. So it looks like we've got a nice option there. So we'll be doing that for the time being, unless maybe something changes with our process with the state and we can verify that, then we would obviously go back to that. And we're also exploring ways to offer that testing free of charge for residents, not only through the end of the year with the CARES Act dollars, but beyond that. So we're going to have those discussions here. We continue to have local contact tracing efforts through our FAST team. We've added 6 more members to ensure the county's fully prepared to deal with this uptick. And the good news is we've had a lot of really talented people come forward, former city councilmen, county commissioners, and other business owners who are really sharp folks that want to get involved. So we're really thrilled that they're joining the team, and that should really enhance our ability to follow up. So our plan, we're going to plan and execute a second mass testing. Again, was talking with the emergency manager about that again. And so he's looking at some dates and calling resources to look at that. Also continue testing for the virus RNA through our City of Winnemucca's wastewater tracking program. That's been really successful. It's been about 7 or 8 weeks now that we've been doing that. We had a flare-up about 2 weeks ago. In one area of town, we could actually identify it, as you know, in one section of town. We sent out over 790 flyers, and the next test that came back We missed 1 week just recently because of some problems with transporting the results back and forth. But the most recent one came in, and that area has really reduced in its RNA number, so we were very excited about that. We had another flare-up in another part of town, so flyers are going out or have already gone out to those areas. And of course, as part of that, we don't just rely on the flyers, but contract tracers are following up in that area. We've also got local radio spots, social media, et cetera. And Nicole Maher, who's our public information officer out here, does a tremendous job, and she's all over getting that information out, especially on Facebook. Local folks have been really great and involved with that. So we're going to continue to work closely with our school district. I believe that our school district has supplied at least 2 people, in addition to the 6 contact tracers I mentioned, that are also doing specific contact tracing within the school district as a way to mitigate HIPAA issues and things like that, so that they kind of keep that within that area. And so I feel really good about that. I did talk to our school superintendent, Dave Jensen, and he says so far that's been very, very successful. We're going to continue to outreach and have strong communication with the Fort McDermott Indian Reservation. I know that Dr. Stringham talks with Dr. Bay up there pretty much daily, and they're in communication. And current communication efforts, including the daily Humboldt County report, which we put out every single day, with updates and information on testing, where to go to be tested, and then public notifications of new cases and the like. We also have increased our public education and communication outreach regarding the need to be tested and highly publicized testing locations. The one thing that has given us a setback on that front is the slow turnaround times. I had a number of people come to me and had heard about my long wait for the testing and said, they know several people who have not felt well, but they're not going to go get tested because they're not going to wait that long, and they're just going to try to stay home as much as possible and be very careful about going into work, which, I hate to say it, that people think that way, but unfortunately, some people, just do. And so I don't know what much we can do about that. Anyway, so the final thing is continue education about wearing masks, social distancing, all the normal things, hand washing. Again, I've been spending a lot of time going to local businesses, restaurants, and the like, just to see what kind of protocols are in place, and I've been really impressed. Locals have really done a nice job, and there's always a few outliers here and there, but generally speaking, I think they've done a great job, and that's the Humboldt County report.
Thank you, Dave. And lots to discuss there. And this is Caleb Gage for the record. Lots to discuss there. Formally, I guess I should withdraw my motion from previously, which I'm happy to do. But just for the record, I do withdraw that motion. But lots to discuss from your report. Really appreciate the comprehensive nature of it. Looking at today's tracker from Monday, actually, but for today, Humboldt is back off of the list, under 8% test positivity and at 100 for average number of tests per 100,000. So those are very positive signs and indicative of the fact that you're moving, the cases are moving in the right direction, of course, and want to see. Well, I'd like to say I think that is in large part due to the exceptional efforts that you just described locally. I am concerned about the enforcement section of the assessment and plan, and would like to ask your perspective on, and this is 2 separate questions, but just putting my concern about the enforcement piece out there. You mentioned a minute ago a number of things at the state level, the testing turnaround. We've been having a number of very productive conversations on that at the state level, as far as identifying what I think can just simply be referred to as the delta between the presentation, the average turnaround time we're seeing in the presentation and what's being experienced on the ground. And I think it was Tuesday of this week, we had a very promising conversation on that. And I believe that we will be able to work on that through diverting some of the enormous backlog into that, as well as finding some efficiencies within the overall system. But do understand that that is a concern. I applaud you for identifying local partners and or excuse me, private sector partners to serve the testing needs of your local community and help expedite that. And I think that's helping us broaden the pie of service providers throughout the state, which is a part of our overall testing turnaround effort at this time. The other thing you said a moment ago, which rings true to me and is something that is extremely important to us. You said, and I wrote it down, that shutting down businesses in the future is not going to be an effective mitigation measure. And I don't want to misinterpret that or mischaracterize that, but it sounded like to me you were saying, because we have community spread, going in and shutting down specific businesses is not going to, or excuse me, specific industries or even business across the board is not going to be helpful in stopping community spread. And I would say in general that I would agree, and that's the purpose of this task force, is to be able to have that conversation with the timeline that we're under right now as far as cases are concerned. Are there other mitigation measures, interventions, real interventions that you believe the governor, the state can make that do not involve business closures that can be helpful in the long run either? Do you have any recommendations?
Thank you, Chair Gage, Dave Mendiola, Humboldt County. You know, right offhand, I think the most important thing from my perspective is education. And I know that Nicole Maher, our PIO, and I have spent a lot of time talking about that. And how do we get the message out? Because again, our experience locally in Humboldt County, and I don't want to suggest that others are like us. I don't think they are, and maybe it's similar, but I don't think so. I haven't heard that. Is that where most of these exposures are coming from private settings where, you know, friends and families get together, even in small groups of 5 or 6. And that's been a problem from the outset in Humboldt County when they had the big uptick early on. And we finally got that calmed down through public information dissemination. And I think that's the answer today. People need to understand that, you know, I think everybody took a break when they saw our numbers go way down and we flatlined and actually started down. And then so people thought, well, we were over the hump. And then I think the key thing that happened was people started traveling again. And it was both residents of Humboldt County going to visiting states and other counties and visiting family and friends and then coming back and bringing it back with them. But we also, I know of at least 5 or 6 cases where people went and traveled specifically to Idaho and visited with family. They got back 2 days later. They got a call, said, hey, you know, gosh, we were all infected and we didn't know it and we're sorry, you might want to get tested. And guess what? Everybody was positive. So I think the thing that we are trying to focus on, the thing I know we're disseminating information constantly, and I think people are getting tired of hearing about it. But if somehow we can take some kind of an approach that really makes people aware of even the simplest of gatherings, if you don't know where all those people have been over the past 10 to 14 days, it's probably not a great idea. And again, even if you do get together, then be really smart about it. And for example, I'll give you a personal example. We had a gathering at my house of just my immediate family, my children and their spouses. And we literally made it a rule. There was no hugging when we showed up. There's no hugging when we left. And we could visit. We could do all those kinds of things, but we couldn't do those kinds of things. And we did that. And again, nobody's been infected. And so, again, if everybody's out doing the right thing on a daily basis, then when they get in gatherings like that, then it shouldn't be a problem. But that's the one thing that comes to mind. I know, Ken, do you have something else that comes to mind?
This is Ken Tipton, the chairman of the Humboldt County Commission, is also with me as well.
No, I don't. I think that sums it up pretty well, what David said. And I don't see other things that I think will work here. Because we don't have any cases that come from a business, we haven't contract traced any of those back. I just don't see that as an option. I think we'd be chasing something that totally is useless for us because that's not where our cases are coming from.
Thank you both for that. I appreciate your the plan that you put together here. We would like to see a plan again next week, and I'd like to make a motion here in a moment. The hospital capacity numbers are promising there. The difficulty of the community spread issue that you talked about, I think the wastewater solution is phenomenal, and I know other communities are using that as well. But there's some really interesting, at least pointers of what's going on in the community coming out of that. That's great. And I'm glad you're using that and doing targeted messaging. The fact that your cases are below the thresholds, or at least the 3 criteria this week, is a great indication of what's going on in the community. I'd like to make, just like I did with Carson City, I'd like to make a motion that we approve Humboldt County's plan as submitted, with the caveat that we come back next week and have detail built out on what enforcement looks like. Right now, I want to keep us from getting to a place where we're shutting anything down. But just having that as included in part of the plan, that these are the numbers that would allow us to go into enforcement, or this is how we're doing enforcement. Anything beyond we're not doing enforcement, it would be great. And I'd be happy to have a conversation with you, Director Reynolds, anybody offline, in order to do that. Again, I'm rambling after a motion, so let me start over. I'd like to make a motion that we approve Humboldt County's plan, with the expectation that next week that the enforcement area be built out to include a plan for next Thursday's meeting. Is there a second?
Chris Lake, I'll second that.
Thank you, Chris. Any discussion at this time? Hearing no discussion, all those in favor, please signify by saying aye.
Aye.
Aye. Any opposed, vote no. Thank you, Dave. Appreciate it. We'll be getting more information on the test turnaround time, which is a major effort that's underway right now. But we'll be getting more information out in the near term. So thank you to. Yes.
Just Commissioner Tipton.
Yes, sir.
One other thing that I don't know if the state can help us with at all. I know the hospital has had trouble getting all of the Abbott fast tests that we need. That would really help us if we could get those tests so that we have enough of them, so we're not just using them on hospital people, that we can test people as they come in.
So are you talking about the Abbott ID Now rapid test kits, the collection kit cartridges, or are you talking about the Abbott Binax Now test kits?
Well, that's a little over my pay scale there, but I think it's the first one you mentioned. The ones
that would be
the 3 machines at the hospital that we can get a result for within a half hour.
Yeah, if it's the machine, then that's the Abbott ID Now, and that's as deep as I can go into it. I know we've got some experts on here, but Melinda and Dave Fogerson, can you follow up with Humboldt County and Dr. Pandori and determine what the need is there, if there's any opportunity to support that, and if we can get a resource request through Humboldt Emergency Management?
Absolutely. I know we had about 1,200 of those tests scheduled to be delivered, and we got 200.
right? They're a very limited resource that's controlled nationally. So we have we're not always able to meet the request. It's also should be noted that that's a screening test and not a diagnostic test. And so really the PCR test, the relationship you're pursuing with the private labs is going to be the most fruitful in expanding that capability. So happy to have a discussion with you offline about that, and we'll continue to provide updates on what our turnaround time is, Commissioner Tipton.
Thank you, Caleb.
Thank you all. All right, I'd like to go now to Lyon County. Do we have Jeff or anyone on from Lyon County to provide a brief update?
Hi, Caleb. Jeff Page, County Manager, Lyon County.
Yes, sir. Thanks for being here. Could you provide us a 2 to 3 minute situation report and then maybe an overview on any of the changes that may be included in your plan?
As you all know, we've been on being monitored now for the last 4 or 5 weeks. Our numbers, positive rates go up a couple percentage points each week. If you look at those numbers, you will see that the largest component is family-to-family contact. We're seeing more cases of the same address with people living together, coming in contact with each other, becoming positive than we are anything else. Based upon the governor's most recent press conference, we implemented a number of, or not implemented, but re-emphasized a number of policies we have within the county for county facilities and large gatherings. We've shut down just about every large gathering there is in unincorporated Lyon County since March. Our senior centers, community centers are closed to the public and have been since March. So we're seeing the two largest positives are in retail, and then of course the family-to-family is the largest of them all. With that, we're trying through public education, and I think one of the things that was discussed earlier, Caleb, is, and I've been bringing it up quite some time, is rural Nevada, not everybody understands that if you get sick in Yerington and you go to the local hospital, chances are fairly decent that if you're significantly ill, you're going to go to a Reno hospital or a Carson hospital. And the change in our population in Lyon County in the last 15 years, people don't recognize that the impact that Renown or St. Mary's or Northern Nevada or Carson Tahoe, we are impacting those numbers. Douglas County is impacting those numbers. Churchill County, Humboldt County, anybody who transfers patients from their facility to a Reno or Carson hospital are impacting those numbers as well. So I think it's important for people to recognize the fact that the Reno area numbers are also impacted by rural Nevada, not just Reno residents. That being said, we are continuing to work with our private industry folks, ensuring that they're following the governor's directives. I heard Mr. Reynolds state earlier that we can go to the OSHA's site to find out what businesses they've been to. I'll have to do some further research, but to be quite honest with you, it's a little difficult to find when they list a 7-Eleven. I don't know whether that 7-Eleven's, which one that is, because it doesn't provide an address per se or a community, so that's a little more challenging. But we are working with one code enforcement officer to take care of as much as we can within the county from an enforcement perspective. The bigger challenge is, as Humboldt County alluded to, are those family-to-family small friend gatherings, not the large gatherings. And that's where we see the majority of our cases coming from, are those type of things where 8 to 10 people get together for a social event, and then somebody's positive, and now you got nine other people positive. And so I don't know how you combat that. I don't know what we do enforcement-wise with that. The businesses, the things that are currently in directives are pretty simple to follow and pretty simple to enforce, but that family-to-family contact is a significant issue.
Thanks, Jeff. I totally agree on the points you brought up, and one of the reasons that we asked for the Hospital Association to provide that overview of hospital capacity was exactly that reason. We're seeing, obviously, Washoe County, Renown is in Washoe County, and those numbers are there, but it really is regional, which is how Kyra and her team are tracking those numbers for hospitalization and that very helpful chart she provided this time that showed the significant increase in hospitalizations for COVID in Northern Nevada. So I guess that, you know, your challenge is the same challenge that we're seeing in many of the rural communities as far as community spread. Do you have any messaging going around or any efforts going around the upcoming holidays, Thanksgiving, or anything like that that would be that would be beneficial? Anything that we may be able to support with on that end?
So we'll be putting out a number of social media releases between now and through the holiday season, reminding people. Again, I can't speak for all rural Nevada, but the challenge that we face are the naysayers, whether it be on social media or through media, some of our own politicians, both from the state level as well as the local level, kind of diminishing the threat, and that is a concern. So we're trying to work with the political folks as well, that if, you know, even if they don't agree, then just be quiet. Let's get through this. Us, like Humboldt County and the rest of rural Nevada, we do not see shutting out businesses as a positive thing to shutting down or to reducing the COVID threat. I don't know that there are any simple answers to these hard, complex questions. I really wish that, you know, as an example, that state regulatory agencies had 4 times the people so they could be in every community every day issuing the warnings. We'll be more than happy to support them. We realize that's not reality. But we will continue the messaging as best as we can to the public and work with the political realm that exists in rural Nevada and see if we can ensure that we can at least diminish the naysayers to just be quiet, and whether you agree or disagree. I find it very disturbing that we're making a political issue out of a public health issue.
Heartily agree with you. That's a challenge we're experiencing statewide and nationwide, frankly. People undercutting a message of taking care of others within the communities is very, very problematic. So thank you, Jeff. I'd like to open it up to the task force now and see if there are any questions or comments regarding the Lyon County proposal.
Caleb, this is Terry Reynolds. Just as a comment, I want to commend Jeff and from a governmental standpoint, because they have really been on point and working with events and really being receptive to cutting out or working with people on their events. And so that has been good. I also looked at the complaint logs, and the number of complaints has diminished over time, and looked at the last month. We've had about 8 complaints that have come in to OSHA. So things are improving. It was we can have it broken down by zip code. So I'm looking at Yerington and also at Fernley. So they have made some strides from that perspective in terms of the overall complaints in those 2 communities. So I think things are improving from that standpoint. We're well aware of the things that Manager Page is talking about in terms of political issues and that. And I'm happy to give him a breakdown when we get complaints, and we can break it down by business and give him the log on that. So happy to do that.
Caleb, this is Jeff. Not that I want to get in the business of shutting down businesses, but one of the things that we are willing to do is if OSHA has a business that is not complying, we're more than willing to work with them if they'll notify us and revoke either conditional use permits or business licenses, revoke or suspend until they do become compliant. We have had, not recently, but in the first month and a half, 2 months of this outbreak, or this pandemic, excuse me, we sent a number of letters to businesses that to tell them to comply, or we would be going to the board to remove their business license. Those businesses did comply. So it's not that Lyon County is not willing to do it. We just need to know what businesses aren't complying. I've got one code enforcement guy and not enough deputies in the unincorporated county to keep track of the violations. And so that is always going to be a problem for us.
Understood. Thank you. And I think following this, Director Reynolds can connect you with the administrator for OSHA at the state level and figure out what kind of approach would be appropriate for that. Thank you. Any other comments from the task force?
Chair Dave Fogerson, if there's no other comments, I'd like to make a motion to approve Lyon County's plan.
Okay, would you, the motion is to approve. Is there a second?
This is Richard. I second.
Okay, thank you. Any discussion on that? My only discussion would be for next week's report, Mr. Page, if you could give us an update on where you are with OSHA as far as any of those enforcement measures are concerned. And again, Director Reynolds will follow up with you on that. Is there any other discussion? Okay, hearing none. All those in favor, please signify by saying aye.
Aye.
Aye. Aye.
Aye.
Any opposed, vote no. Okay, motion carries. Thank you very much, Mr. Page. Appreciate your time and your support on this. Do we have anybody on from Nye County?
Good afternoon. This is Scott Lewis reporting for Nye County. You know, quite frankly, over the course of the last 3 hours, I think we covered most of the issues that pertain in Nye County as well. But in general terms, Nye County is experiencing some great challenges. We have a significant increase in cases. We have our testing issues, and we also have our test positivity. As you can see, as reflected in our chart that's attached for your review, we have a significant spike that has occurred over the past week, and that spike is related to a detention center located in Pahrump, with a significant number of both employees and detainees having come down with COVID. During the course of this meeting today, we've also been identified of a significant exposure in a skilled nursing facility also located in Pahrump that we are visually and vigorously addressing during the course of this meeting. You know, when we talk about the counts and the flags in the rural areas, it's extremely challenging when we talk about resource levels and requirements, the availability to muster a great number of people in a short fashion, and that continues to be one of our challenges. We've had some really great successes, though, and I would just like to share some of those that include the cooperative spirit between some of our target hotspots. As noted in the report, some of those target hotspots include some highly secured facilities located within Nye County, but there's been a commitment at those particular facilities and at those levels that they were going to do what was necessary in order to bring those numbers down and not have a negative impact on the county itself. We've also had a steadfast commitment within the county to ensure that we were doing things to the very best of our ability, including the following suit with many of the Southern Nevada cities in closing down our government, as far as having people work at home and trying to limit the number of citizens coming into the workplace, trying to minimize those exposures and risks. And we continue to evaluate that as we speak. When we talk about the school district, for example, the high school here has gone to virtual based on an elevated case count. They have closed down classrooms. They have closed down grades. They have since closed additional extracurricular activities after school. They have been just exemplary in communicating with us of what they're experiencing, what their expectations were of the county government, and also what steps they were going to voluntarily take. We've also looked at it from the standpoint of the community, and that is, I think, still one of our biggest challenges. And I think it was just eloquently stated just a few minutes ago. Social media continues to be a huge challenge for all of us. The people who are fighting everything that we try to accomplish in order to protect our communities and our citizens, it's disheartening in many different levels. We have addressed it through additional PSAs, Additional messaging, our PIO has just done, Arnold Knightley has done an outstanding job. He's involved in all these meetings and has put in an extraordinary time and commitment to making sure that the absolute correct information is getting out there and trying to minimize the incorrect or the opinion segment that's currently underway. We are working closely with our hospital, who is experiencing its challenges as well. It is fair to say that they have had a capacity rate around 90 to 95%. A good number of those are COVID positive, and under review would make up the majority of the remainder. Their ER has also been inundated with COVID positive patients among staff. However, they're not necessarily reflected in Nye County because they actually reside in Vegas, many of them. But we are keeping track of them, so we have a complete understanding on the transition of patients in and out of the ER area. They are also, not many patients are on ventilators, but we are conducting interfacility transfers of many COVID patients to Las Vegas-based hospitals, where at least the 2 additional patients have died, which are reflected in our daily reports. We do have a significant number of patients that are currently very sick, and we're keeping close watches on them as well. The hospital is reporting that their PPE supplies are adequate and without issue. Within DEM, we are working very, very closely on the testing capacity throughout the county. And as you know, our large geographical footprint adds challenges to our accomplishments. However, we are doing a decent job, in my opinion, and I think that's reflected in some of the numbers on the outlying areas that are reporting very little, if any, additional cases of COVID. We're also watching a very small community on the north end where one single person who is a non-resident of that community who works there may have impacted several additional people in that small community. So these are our challenges as they continue. Our testing capacity, we are experiencing an increase or an uptick in the number of people testing. There are additional testers that are working in the area. Our timelines have increased a little bit since my last report, and most of that is attributed to the fact that volume is driving that whole component as far as so many different people testing. The private-public partnership continues to work well for us. Like most other cases, our investigation and tracing is strained. We have placed additional internal staff into those positions, and they just have been doing an extraordinary job in getting the job done and getting the information back to the state. The state's group has been just wonderful to work with, and getting the information back. We are talking literally 24 hours a day, and I think that's a really great demonstration of the commitment from both parties. Our vulnerable populations, we continue to address with great heat, and to make sure that they have all the necessary PPE and all the tools to be available. Our enforcement, which is really paramount in all the discussions that have gone on today, we are regularly referring caseloads not only to our code compliance, our law enforcement branch, but also to our partners through OSHA. While most of our grades from OSHA, if you will, are actually quite good, we recognize that there's still some areas of opportunity, so those notifications are still being made on a regular basis. And quite frankly, most of the businesses have been pretty decent. We're finding, much like everyone else's experience, that the family gatherings are a true challenge, whether it's weddings, funerals, baby showers, whatever it might be, just even small congregate groups, they've added to our challenges. The other group I'd like to talk about real quick is our religious groups. We've had outbreaks within 3, may even be 4 now, religious groups within the valley. One has voluntarily closed. The others have taken a whole new set of measures to ensure that they are protecting their congregations, including shutting down after hours, Bible groups, things along those lines, men's groups, breakfast, things along those areas. We continue to work with our positivity test rates and making sure that we get in contact with them as quickly as possible. And our case rates, if you're not familiar, if anyone needs to know, we are just approaching about 1,000 cases in Nye County. So we are keenly aware of that, and we are taking every necessary precaution that we can. And I'm available for any questions that anyone may have.
Thank you, Scott. I appreciate that overview and the situation there. It's thank you for the specifically for the section in your report that calls out the areas where you're seeing trends from, particularly the correctional facility and the other federal facility. I know those are challenges from jurisdictional purposes or from a jurisdictional perspective, but it's good to kind of see the whole overall picture. I'd like to turn it over to members of the task force at this time, see if there are any questions, comments, concerns regarding the Nye County report. From my perspective, Chief Lewis, looking at it, it looks and sounds a lot like the challenges we're seeing in other rural communities, Lyon County, Humboldt County, where we're seeing a lot of community spread. I do appreciate the political challenge and the messaging challenge, and I don't know necessarily what to do about that. The conspiracy theory type approach to some of these issues, but and otherwise. So I know that's a challenge for you, and we'll continue to try to think about ways to address that. Do you have any, with kind of the same question I had for Mr. Page, do you have any messaging going out regarding the upcoming holidays that we may, since we may see some spread related?
Yes, thank you. We are addressing that through our public information officer. He is sending out materials that he has researched through CDC requirements and recommendations, and they are regularly being distributed throughout the county websites. We're trying to utilize every type of forum possible, whether it's at a Board of County Commissioners meeting, just our daily interactions through either fire or Department of Emergency Management. We continuously reinforce these models. It really depends who the audience is and on how receptive they are and where they believe the most accurate information is. And it is disheartening to know that they feel that Facebook is a reliable source for scientific information.
Yes, indeed. Any other members of the task force have any perspective or any thoughts on action, ways we might be able to move forward here?
Chairman Cage, if I could offer one last thing, I just have to state I echo the sentiment regarding the extension of the CARES Act. If there's anything we can do on that front, that would be greatly appreciated. Getting some of the materials in by the timelines is becoming extremely difficult.
Some of the materials, are you talking about things that you order, or are you talking about test turnaround? Can you expand on that?
So materials that we're trying to order under the CARES Act to further protect not only our citizens, but our staff and throughout the county. Getting that material in, it's one thing to get it ordered, it's actually to get it in before the timelines expire. Very difficult. So we're trying to comply with all the requirements.
Appreciate that. Yep, that's a significant concern we have statewide, and we'll continue to work with our federal delegation to see if we can get those timelines expanded as one aspect of our efforts with the federal government. Anybody on the task force with any additional comments, questions, thoughts on how we should proceed with Nye County? Okay, I would like to make a motion that we approve Nye County's plan, continue to monitor with plans going forward as is, particularly with respect to the high number of cases occurring at the federal facilities there that are impacting their community numbers. So my motion would be to approve the plan as provided. Is there a second?
Caleb, this is Terry Reynolds. I'll second that plan, your motion.
Thank you, Terry. Any discussion on the motion currently under consideration? Hearing none, all those in favor, please signify by saying aye.
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 Aye. Aye.
Any opposed, vote no. Okay, motion carries. Thank you very much, Chief Lewis. We know you're working hard out there. Thank you for what you're doing, and we'll continue to talk to you and hear back from you next week.
Thank you for everyone's support. We truly appreciate it.
Thank you. Okay, at this time, I'd like to move on to Washoe County is on the phone. I know we had Health Officer Dick on earlier. Do we have a representative to provide us a brief overview from Washoe County and any updates on their plan?
Thank you, Chair Cage. This is Kevin Dick, District Health Officer, and I believe that Manager Brown is also on, but I'll begin. We are seeing a continuing surge of cases that are occurring in Washoe County. Our 7-day moving average continues to increase. It's at 342.1 new cases per day as of yesterday, when we reported 410 cases. That's almost 3.5 times as many cases as we were having occurring at the beginning of October. For some perspective on this, I did compare the new cases per day that we're experiencing to what Clark County experienced in July when they reached the peak of their surge that they had there. And when you normalize for population, we're at a level of about 140% of the peak that Clark County hit during their surge. And it is having an impact on our hospitals with increasing numbers of COVID-19 patients. And you heard that Renown Regional has begun to utilize the build out that they have in their parking structure. The number of cases that we're receiving that we're having is also causing increased demand of our testing throughout the county, but with our drive-through testing at the post, demand has increased. We had a record day today of 718 people tested through the post. Because of the high levels of demand for testing, as well as the capacity limitations that we have with our labs, and the delays that we see with test results coming back, we made the tough decision to, at this point, limit testing to symptomatic individuals or asymptomatic individuals in priority populations that include close contacts, first responders, healthcare workers. We had been also trying to expand capacity for quick turnaround, working with the Renown lab at the hospital for a limited number of tests for them to run with it for us. But we received word yesterday that they no longer had capacity available for us based on other testing that was coming through healthcare system. The number of cases that we're experiencing has overwhelmed our contact tracing efforts, and so you'll see in the report that we have significant delays in being able to do disease investigations. We are hampered by the lack of a good electronic data management platform that could be used for the disease investigation efforts and tying that with contact tracing. We had I believe, a productive call with state representatives the other day to talk about using perhaps a Qualtrics or an EpiInfo platform that would allow us to manage the number of variables of information that we are obtaining when we're doing our disease investigation work, and also to be able to set up more of a self-implemented disease investigation survey that cases could take online to provide information to contact tracers. That would allow us to prioritize the work of our human disease investigators, and currently we are prioritizing around pediatric cases, schools with multiple cases, UNR and TMCC students, as well as households with multiple cases, and first responders and healthcare providers. But I think we heard from Ms. Peak that the contact tracing is finding 25% of cases statewide, so that means most of the cases are coming from the widespread community transmission. That's what we're experiencing here. And I think that, what our situation now is we basically have a COVID-19 wildfire that's occurring. And the idea of contact tracing, where we're going after individual trees that are on fire, is not an effective strategy in that situation. And that's why the comments that you made earlier were so appropriate around the need for the community to be engaged in the precautionary actions, the mitigating measures that can help to turn our numbers around. I should also mention in regard to the testing that our emergency managers in Reno and Sparks are taking the lead in planning for pop-up testing locations. I don't believe that the dates are final and publicized at this time, but dates that are being planned around currently are November 22nd for testing in the 89502 zip code and a December 6th testing in the 89431. I do have a couple of corrections that I'd like to note on my report. I apologize for this. On pages 8 and 9, when I listed the organizations that had more than 4 positive cases on page 8, there was a typo in there. Renown Health was listed twice, so I wanted to clarify the correct number for cases is 13. That shows up in the report, not the duplicative Renown Health that has 18. And then somehow restaurants got deleted on page 9 in the list of places that people had been 2 weeks before they became infected. So I apologize for that and just wanted to provide that clarification. And with that, I think I'll turn it over to Manager Brown if he's available.
Thank you, Kevin. And just a couple of updates, Mr. Chair. Number one, as far as our outreach efforts, now that the election is over, we're beginning to see our traditional media around the outreach campaign take root and air on TV and radio, as well as continuing to be run in the Spanish language media and social media outlets. We'll continue to escalate that activity in a lot of different other ways, including bringing some of the most notable community members into the fold in terms of their advocacy for wearing a mask, social distancing, etc. We, in addition, have stepped up our enforcement efforts. I mentioned that in the report, but just for the benefit of the committee that's not in the report, I want to acknowledge that the city of Sparks has stepped up in a big way over the last couple of weeks. This week, for instance, they actually inspected 18 of their 26 bars. And both Sparks and Reno exceeded 2% of their licensed businesses with storefronts that are not home-based businesses in terms of inspection activity. So that has been stepped up significantly. We are also stepping up our efforts to promote the tracing app that the state has provided. So I wanted to highlight that, and as well as our efforts working with Julia and the other folks at the state in terms of figuring out how to address, I guess, medium term and long term, our contact tracing challenges by figuring out platform solutions that will allow us to benefit from some of the third-party contact tracers or disease investigators that might be available in Southern Nevada. That's all I have for this week, Mr. Chair.
Well, thank you both. I see Chairman Lucy's on as well. Go ahead.
Yeah. Thank you, Mr. Chair. I appreciate the opportunity. to add to the report from the health district officer and the manager, I have been in conversation continuously with Superintendent McNeil at Washoe County School District. I know there has been some concern amongst, as in previous weeks from the reports of the school district, that those being challenging places for our community. However, Superintendent McNeil met with her board this week. They did have a board meeting on Tuesday. Their board is going to continue to move forward to work towards, as with the health district and with the county, to address problematic schools and continue to shut schools down as they see fit if there's massive spread within the schools. So they are staying resolute in their continued efforts to address the issues within the school district, within their staff and within their students. So as long as we continue to do some of the surge testing within our high risk area codes, move forward with the messaging. They also are doing a number of messaging out to their parents and through the students and through their outlets to address some of the self-assessment, the mask wearing, any challenges they may see. And so they will continue to shut down classrooms or schools as they see fit and move to distance learning. And so we will stay in close contact with the school district to address their needs and continue to support them in any facts or any cases that they may have going forward. So I just wanted to add that as well.
Appreciate that, Chair Lucy. Anybody else from Washoe County? Okay, I appreciate that. It is a complex landscape, right? With the health district, the county, the political subdivisions, the school district, and otherwise. Looking at Washoe County as the epicenter of the surge, and Health Officer Dick, looking at or hearing your comments earlier about 140%, if I understood you correctly. The current surge in Washoe County is about 140% of what the surge back in July in Southern Nevada was. We know that this is the critical area in the state. We've heard from some of the rural partners who recognize that their your hospital capacity is their hospital capacity, and we know that those boundaries are pretty non-existent as far as people moving from rural communities into our more urban areas for goods and services, as well as hospital support. I guess my question would be, first of all, before I get to my question, the enforcement numbers in here, getting Sparks, Reno, Washoe County, everybody on the same page there, seeing the numbers increasing, great job with that. And I know it's a challenge, and I hope you continue to look for opportunities there. A couple of very good conversations with you and other jurisdictions this week regarding the test turnaround time, which I know is a critical concern, as well as the platform for contact tracing. I know that in the immediate term and in the long term, that strategy as well. Given the governor's announcement on Tuesday, do you have recommendations, things that the state can be doing, recommendations that the county and jurisdictions within the county can be doing differently in order to address this over the next couple of weeks while we're monitoring it? And we know that that's a very short timeline, but there are things that from a mitigation standpoint we could be doing, or we could be supporting you in doing in the near term in order to address this surge we're experiencing.
Chair Cage, Kevin Dick, District Health Officer. I think what we've seen occurring in Washoe County is similar to what we've heard from others today, from other counties on the call, where these private social gatherings are continuing to be occurrences which are driving spread of disease. Unfortunately, we had several large parties of 100 to 200 people that occurred over the Halloween weekend that we're aware of. And so those are continuing to occur. And I think we all need to just be continuing to work on the messaging around the potential for spread that those create and to avoid them. Actually, while the task force meeting was going on today, we issued a press release with our recommendation on Thanksgiving holiday, that those celebrations be limited to just people within a household and avoiding having other households join in for those events. So I think that's an important thing to continue to message. You know, we don't conclusively have particular hotspots that we can point to from the case investigations otherwise as a type of industry that where we're seeing our investigations saying yes, it's spreading and from those types of businesses. So the you know, what we've provided in the report is, you know, where people have been that they tell us about in the couple of weeks before they became ill with and were diagnosed with COVID-19, but that doesn't mean that that's necessarily you know, where the spread came from. I can tell you that it's encouraging that the number of people that said that they were at a social gathering was down over this past 2-week period from the numbers previously reported. So I'm encouraged that perhaps the public is starting to get that message.
That is an encouraging sign. Any other questions or comments from task force members? Okay, I just wanted to open up the floor and see if there were other considerations. The home gatherings, the private gatherings, and the spread associated with that, right now we're seeing the surge in cases, which are a month ago we started seeing the surge in cases, and we noted that from there we would see the surge in hospitalization. And I think that Mr. Olson and Mr. Van Houweling's presentations from earlier today show that pretty clearly. The center of this current surge we're experiencing in the state of Nevada is in Washoe County, and that's a statement of fact regarding the data we're seeing, and not a critique. I hope you know. So in the event that we have in the event that we do have additional mitigation measures, if the governor does decide to implement additional mitigation measures in the next 2 weeks, do you have any recommendations that you've been working on, or any methods that may be able to address the particular type of community spread you're seeing in Washoe County? And I'll just open that up to all of Washoe's reps.
Well, this is Kevin Dick, District Health Officer. As I said, it's difficult to say based on data that we're collecting from contact investigations or disease investigations, a particular industry. That said, there are a number of communities that are focusing on restaurants and bars, and that is an environment where people are removing their masks when they're indoors while they're eating and drinking. And so just from our understanding of transmission, that would create an environment that would be more conducive to transmission. However, I believe that we need to weigh that with I think what we have seen previously, where if those venues that do have some controls around them with regulations aren't available for people to congregate for their they're gathering in a public venue, it may drive more people into the private gatherings that we know are a problem.
Definitely illustrates the complexity of the issue very well, Mr. Dick. Thank you.
Chairman Cage.
Yes,
Chairman
sir.
Cage, if I can. The manager and myself have been working diligently with Ms. Peak to identify other potential opportunities with contact tracing to try to help create a more robust contact tracing program. We are still doing some integration issues with Deloitte and some issues with AAA, and identifying some other access to staffing here within the county itself to try to bring those individuals online as quickly as possible. I hear the challenges that the health district officer is sharing today. I think we could be doing a better job, and when the manager and I are working to try to improve that as quickly as possible, along with the health district officer. However, that does take time. We did start working on that a couple of weeks ago, but we are trying to get that moving quicker and hope to have that online as quickly as possible. But we are working with Ms. Peak and getting and your staff. But the more we could do, the better we can do in regards from state. If there are any more opportunity to help us with contact tracing, I know the National Guard has been very influential in regards to our surge testing locations. But realistically, we need to get some better data to get a better handle on this to really help the information, because right now we just do not have enough data to really pinpoint specific areas of focus. And I think the delay is not allowing us to address the quarantine issues in a timely manner.
Thank you. I appreciate that. Yep, those conversations have been fruitful as far as the contact tracing is concerned.
Chair Cage, this is Dagny. Excuse me, and I was going to sort of say just that same thing, and I want to follow up that I know how important improvements in the contact tracing and ability to test would be in Washoe County for them to be able to manage this. And so I don't know if there's additional opportunities there, ways that, you know, but there's any other support available. And I know that, you know, in other counties, and it sounds like Washoe County too, that the county itself internally is lending support to those things. And just wonder if there's a contingency plan for when the Guard goes away on December 13th in terms of staffing.
Right now we're working with thank you, Dagny. This is Caleb Cage for the record. Right now we're working with the federal delegation on a number of issues regarding National Guard support and funding and the funding deadline that we've seen or that we've talked about earlier for the CARES Act, the 12/30 deadline. Those are up in the air right now. And so we have about a month left of time available with the Guard. And I don't know if any of our other task force members have any updates on that at this time.
And Chair Cage, this is Bob Lucy again. And I think that's one of the biggest challenges, as we've heard earlier in the meeting today, being that Washoe County is kind of a larger epicenter for some of these growing cases within our community, but so not just here in Washoe County, being that we serve as a hub for Northern Nevada for a number of the counties along the I-80 corridor in Northern Nevada. This is an issue that, you know, in 6 weeks, if we better have a very sound plan in place to address the contact tracing, the continued testing, and those models, whether that's in conjunction with the state or here locally, we have got to figure this out, because even if the funding goes away on the 31st, we have got to have a plan in place, because we cannot continue to address this at the level that we feel is necessary. And I believe that the state would really like us to move at. But if we can't, we got to find a plan. And we're willing to work with you, but we need to find and identify either funding sources to continue the program as set, or change the narrative. But we have to work on that together. And I think collectively, because it's not only important for Washoe County and flattening our curve, but also in how we would impact the remainder of Northern Nevada.
Yeah, I totally agree on the resourcing side, and those are that's the value of these meetings, even if they do even if they are lengthy, the value of these meetings is getting together and looking at what those priorities are and seeing how we can work together going forward and what those state opportunities are and the federal or local opportunities as well. So I agree with you. I just am trying to, at this point, sort of see, if we are looking towards the resourcing side, helps us build capacity, hospital capacity, contact tracing capacity, et cetera, to use the wildfire metaphor that Julia has used and that Mr. Dick used earlier today as well. Are there mitigation measures that will help us be able to balance the public health and public safety factors here with the economic factors? Because we know the shutdown earlier this year worked. The cases declined because people weren't out going, but we know that there was a significant economic cost to that. We know that in late June, even if you look at Mason and Eric's slides from earlier, late June, July, when the mask order was first put into place, we saw a decline in these sorts of things. So what's the, I guess my question, and maybe it's the question, the broader question here is, in the near term, while we're surging, what are we going to recommend? Are there local actions that can be taken? Are there state actions that can be taken beyond the current mitigation measures to ensure that we can end the surge, protect hospital capacity, protect life safe and health of the community, while also building those longer term essential capacities and the long-term strategy as well. So trying to look at all of those pieces together.
I think one other challenge to Chairman Cage would be Bob Lucy again for the record, is housing issues. We have a number of our population that cannot house and quarantine safely due to as you pointed out, the economic issues from a shutdown earlier this year. Many families have had to co-locate into one residence, not proving to have adequate and suitable space to quarantine themselves, which thus creates a challenge within our hospital association and at our hospitals that those individuals, if they cannot quarantine safely at home, are having to stay at our hospitals for a 14-day period or find some other. So we're going to have to identify housing as another big piece of this. Now, Washoe County did stand up our Edison housing project for over the 6 months that we had access to those trailers and had suitable, but we've had to demobilize those in September and no longer have access to that. So we're going to have to address housing as well, because and I think that Mr. Whitley would agree with me that is also a massive challenge here within Washoe County that we're going to have to address as well.
I appreciate that. I know that is a I don't want to say tangential, but that is definitely one of the overall complexities of this. Other members of the task force, anything to add? Any thoughts on Washoe County's plan and assessment at this time? Colonel Comston, did you have anything to add regarding any future capabilities of the National Guard or availability of the National Guard?
Mayor Rogers, Lieutenant Colonel Compton for the record. So at this time, we have no indications that we will be extended on federal Title 32 orders, and therefore all missions that Nevada Guard are currently supporting will terminate on the 13th of December. Of course, I am aware that there are discussions ongoing of a potential request for extension. Obviously, we know at the national level politics will play into whether that's approved. And then, of course, there is the option of state active duty using FEMA reimbursement, but that would obviously be up to the governor and availability of forces.
Thank you for that update. Any member of the task force like to make a motion? Any thoughts on direction we ought to go with Washoe County at this time? I will move now to approve Washoe County's plan as written, as provided, And I'll add some other thoughts to that on next steps here in a minute, but I'll make a motion to approve the current plan. If there is a second.
Thompson seconds.
Thanks, Brett. Any discussion? Hearing none. All those in favor, please signify by saying aye.
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 Any opposed, vote no. Okay, great. I know we have a follow-up on test turnaround and contact tracing with you all, and just look forward to continuing the discussion. So thank you all for your time from the health district and from the county and county leadership as well. So thank you. Go now to Elko County. If anybody's on the phone from Elko County, if you could provide us a 2 to 3 minute update and an overview of any changes to your plan that are provided today.
Good morning, Caleb. This is Matt Peterson on. Amanda just had to drop off. A lot of concurrent calls today for COVID. So we're setting it over about 340 cases as of this morning. I don't have the exact numbers in front of me. What we're really looking at doing, we added the enforcement piece back into our plan just to bring it to light again. We've been really trying to work through those testing issues and testing problems. I believe Delmo's on, but he wasn't planning on speaking. If he feels like he needs to add to it, we can though. We've been just working through that. Our hospitals are doing okay at maintaining. We do fear the same as I can't remember who made the wildfire comment though, as well with our contact tracing that we're falling behind on. We're trying to put out single tree fires when we have a massive flame front in front of us. And so we're trying to work through those. Our plan is relatively remain the same. We are starting a public information campaign a little bit with the wear your mask, keep the social distance, trying to keep our businesses open, trying to keep our folks and our economy going, as well as mitigate and treat COVID, which is I'm seeing a troublesome case across the board.
Thank you, Matt. I appreciate that. Looking over the looking at the assessment and the action plan that you put in place, I know we have some issues with testing and test turnaround, and like I said a moment ago, or at the last meeting, we were digging into that. I've gotten a number of calls from elected officials in the area regarding the Binax Now tests and the availability of those. So I'd like for Melinda to address where we stand with that situation right now. And I know that there's an effort underway to build some testing capacity in at the hospital out there in Northeastern Nevada Hospital as well. So happy to dig into any of those efforts that are underway. Are there any other locally driven efforts to build capacity or to work on expanding your capability with testing, specifically with the testing turnaround issue?
So we've explored using additional testing sites such as the UMC, LabCorp in Salt Lake, and then as well as trying, a lot of our conversations are geared around that. What can we do to use different testing centers to maybe reduce that workload on the state lab in the Reno area so that, we'll reduce that workload and it'll help those turnarounds all the way around. And so we've explored those options. We're just struggling on getting through the piece of which one to implement, how to get them. The logistics of those pieces increases quite a bit by not being able to use our own state lab.
Understood. Melinda, can you give us Sorry, was that Amanda?
Sorry, Caleb, it's Amanda. juggling a couple of different meetings here. So just to add to that, we are still in conversations with UMC. Thank you to Chief Samuels and to you for connecting us last week. As you mentioned, we are looking at, and sorry if I'm repeating what anybody's already said, but moving very quickly forward with building capacity right here in Elko, which is very exciting considering that we might be able to help even some of our surrounding counties, whether that be Lander or even Humboldt for that matter, or White Pine County. So the hospital is willing to make space for us. We also have the potential of building capacity at the Ag Lab here. So in the short term, I think that's very doable. And thank you to Dr. Pandori and the rest of that team that's been helping us move through that process. So the biggest challenge that we kind of have in front of us right now is the staffing for that, at least maybe, yeah. So that's really the biggest challenge that we have, but have had several meetings since our last task force call, and I think that's moving quickly. A lot of our local providers are sending to, for example, LabCorp or another private lab. We are still using the State Health Lab for our skilled nursing facility. We just got another couple positive cases out of there, whether staff or residents. Today, they were tested on 11/2 and just got those results today. So working again with them, they're also seeking options on their own. But those are going to be, protecting our vulnerable populations, our high-risk populations is really what our priority is. So that continues to be an issue while we're searching for the short-term solution. But I see kind of some light at the end of the tunnel. I don't want to be too optimistic, but I do see some light at the end of the tunnel. So that's kind of where we're at with the expanding testing capacity here in Elko.
So just to clarify, light at the end of the tunnel, is that in terms of the testing turnaround, or is that the case rate? Which tunnel are we talking about, I guess?
Sorry, I'm just talking about test turnaround time.
Understood. We've got Melinda on right now. Melinda, I'd like for you to provide an overview or an update on where we stand with the Binax Now distribution. I know we've got a lot of questions out of Elko on that lately.
Absolutely. Thank you, Chair Cage. So Melinda Southard for the record. So we have received a resource request from Elko County for the Binax Now tests, and we have assigned that resource request to the state warehouse for fulfillment. The state warehouse is in current conversations trying to arrange for delivery of those tests to Elko, hopefully tomorrow. And we are under the impression that Elko still has not gotten the appropriate CLIA certifications in place. However, we are willing to distribute those tests to the county with the signed acknowledgement form that the test may not be performed on individuals until those CLIA certifications are in place. So we're ready and willing to get those tests out. And then as we receive more resource requests to the state EOC, we are working on distributing those to the warehouse and getting those tests out as well. Thank you.
Melinda, that's the that CLIA waiver is a federal requirement. Is that right?
It is a state and federal requirement.
Okay, and so we're looking for and just to make sure I understand this, if there is if Elko County School District wants to use Binax Now tests on school children, then they would need to have a CLIA certified way of doing that. Am I thinking about that correctly?
Right. So Melinda Southard for the record, we've been working with the Department of Education on that and getting the school districts as well as private and charter schools the ability to administer the Binax Now test in the school setting. So we've been working with the Bureau of Healthcare Quality and Compliance to develop compliance agreements for each of the school districts that would be interested in that capability, and then working to basically expedite that process so that we can get the Binax Now test out and implemented within the state.
Thank you. I appreciate that. Any other
Caleb,
questions? Yeah, go ahead, Amber.
Well, yeah, so on that note, we did run a report to determine which of our local clinics and or providers currently have a lab license that could get through that process more quickly as far as approval for just the test. And so we've reached out to them. I know one of those we have an issue with because of a lab director thing. I know they can only oversee 5 labs, and I think this would be a 6th lab for him. So that's a challenge. We're working through that. And then Nevada Health Centers, I believe, is also applying for that approval. And I think we've got one other clinic that's applying for approval as well.
Thank you. I appreciate that. Other members of the task force with comments, input regarding the ELCO plan and current situation report?
Director Cage, it's Colonel Thompson. Just one item of emphasis as we get toward the voting portion of this. Having read this thing in detail and having had the pleasure to spend about a week up in the ELCO area recently, I do think that we, much like we have done with all the counties, but maybe more so a little bit here in ELCO, need to emphasize a robust emphasis on enforcement. Obviously, from personal observations, I was in a number of their businesses, and quite frankly, I was quite scared. Probably the most scared I've been in the last 8 months that we've been doing this. So I do think that if we vote on this, I would ask that we ask for a more robust detail on their enforcement actions the next time they bring a report forward. And I would invite them to maybe look at Washoe County's plan, pages 11 through 13, as maybe a model.
Caleb, this is Terry Reynolds. I would echo that same thing. We've seen a pretty significant amount of complaints coming out of that area over the last month. So I looked at the data from 10/4 to the present, and we're still getting considerable amount of complaints. So I think there is some merit to stepping up with enforcement in the area, and I think that would help considerably.
Thank you both. I think that's important input. The step process that they have, I think, is great. I think having a specific overview of what actions are under enforcement. Also, I'm confused a little bit. Amanda, maybe you can help me with this. In the enforcement section, it says, let me find it again. Sorry, first violation, second violation. At the bottom of the enforcement section, it says Elko County wants to make it clear that individual businesses will not be held liable for the actions of their customers. Is that saying that your local enforcement agencies are only enforcing employees, following the restrictions of employees, or how does that work? Because that looks very different from what we're seeing in effect in other counties as well.
Yeah, so that was something that we included at the request of one of our board members. I don't know if you recall, shortly after the special legislative session we had, I believe was SB4. And so if there was a patron in an organization or a business, we didn't want the business to be penalized for the actions of the patron. So that's what that's centered around. Again, we pulled this out of one of our older plans. This is going to be an issue for Elko County, much like we've heard from some of the other rural counties. Local political leadership is very divided as we work through this, and it's very difficult to have an enforcement plan, especially when we're talking about elected officials to support this, and that is a challenge. And thank you, Director Reynolds, for talking about the complaint piece, because that's one thing that I do think would be helpful for us, is to be able to target, I don't want to say target, but to be able to focus these conversations with the organizations that are receiving complaints. That's not something that we've seen recently. So if that's something that, if we can get that information, that would be a good start for us. And so, a couple months ago, we had the softball tournament that was not supposed to occur. And the city did a really good job of working through that process, has removed licenses, I'll call them, or field permits from the organization that held that against the directive at the time. And interestingly enough, that got submitted to our DA's office as well as to the AG's office, and it was declined for prosecution. So that's also a challenge. But yeah, we're very aware that this is something that we do have to work on.
So I guess my problem, and Director Reynolds, maybe you can clarify for me, that line in particular seems to neutralize the entire enforcement program that's proposed in the plan. So what it seems to me that enforcement has to include, has to hold the licensee accountable for their employees as well as for people who enter their establishment. Am I thinking about that correctly, Director Reynolds?
Caleb, this is Terry Reynolds. Yes, you are, Caleb. You know, I live in a community and I go to the store and there's a person sitting there making sure that I have a mask on before I go into the store. And, you know, that's something that, you know, is, we have cited businesses that don't enforce that standard. So it needs to be done. You know, that's a major gap in kind of the overall enforcement to be able to have a secure environment. So that just needs to be done. And the spread of cases, you've got to start, you know, where you have gatherings, where you have people interacting, and they need to wear masks. And that's what the governor was getting at in his speech, and with the directives, it basically says you shall wear a mask when you go into public places and into retail, restaurants, and different commercial establishments. So that is significant.
Thank you for that, and Amanda, I appreciate your point, and I know you're caught in the middle of this, and I don't envy your position or Matt's position here with a divided board or divided local electeds regarding the this virus. I'll tell you, I'm sure I don't have a breakdown of how many people who register as a Republican or a Libertarian or a Democrat get this virus, but it's I can very comfortably say it's across the board, and it obviously doesn't care of any of the politics of the person that it is infecting. With the case surge right now, well, before that, I've certainly been reached out to by local elected officials who've told me, you know, the turnaround on the Binex test is unacceptable, who've told me that shutting down any of the efforts the state is doing to mitigate is well, they've had plenty of choice words for me, which I won't repeat here on the record. I've certainly had elected officials telling me that well, I've heard of elected officials in the state saying, well, we're not going to take any actions here because it's much easier to blame the governor for taking those difficult positions in the long run. And I'm not criticizing you, Amber. I know you have an incredibly difficult job there. When the 2 weeks are up, the governor's going to take a position on what has to happen in our state as far as mitigation measures are concerned. I do understand that there are political concerns and that people have varying viewpoints on this, but I personally believe that it is, from the task force perspective, that sort of lack of clear, coherent messaging from elected officials at the local government level is unacceptable, and it's only going to have a long-term negative effect on Elko County. And so I am extremely concerned about a plan that has an enforcement plan in it, and then a clause at the bottom that basically undermines that entire enforcement plan. I'm concerned about Lots of concerns about testing, and I understand the testing turnaround is difficult at the state. I'm concerned about the slow ownership of the testing problem by the local community as well. We're working on state capacity, but there's plenty of things that can be done at the local capacity as well. And Binax Now tests are not the silver bullet. And until we have CLIA certifications, we're not going to have those distributed or for use because that's federal and state law. So I'll take calls from elected officials who'd like to criticize me for that all day long. I'm not going to change federal law through a state task force here. I don't see how in the middle of a major surge, we can approve a plan that has zero enforcement in effect or in actuality. And considering that we have spent considerable amount of time having discussions about this and still seeing we're putting a lot of this on testing turnaround. Okay, but we don't have any mitigation measures locally. I find that unacceptable. So I don't know. I'd open it up to other members of the task force now to see if there are anybody who would like to challenge that or add to that or shares that.
Chair Cage, Dave Fulgerson.
Go ahead, Dave.
We've been hearing I think this similar conversation from a lot of local jurisdictions. We've heard the same issues from Jeff Page in Lyon County earlier. And we got to figure out a way to not politicize the public health issue and how this is not about one side or the other, but this is about humanity and how we get public health and healthcare providers and all those science-based stuff understood and focused on. And I would agree with what you're saying here as well, but trying to get some more of our political officials to be more supportive of the stance that we need to take in order to save lives and increase infrastructure within the healthcare community in our state is pretty important.
Thank you, Dave. Any other members of the task force have perspective you'd like to add on this?
This is Megan Worth-Ranson. I'll note, I just appreciate Amanda and Elko County's work on their plan. It is concerning as well that Elko County is specifically called out for the past 3 weeks on the White House task force document as being one of the biggest counties with the biggest problems. So I think that needs to be taken into consideration and addressed as well, that it is continuously in the red zone for cases.
Thank you, Megan. We've got a wildfire, right? I mean, this is something Matt said from there and others. I'm not seeing mitigation and enforcement measures that reflect the seriousness that we're seeing there. Reductions in gatherings, reductions in any of that. I see plenty of identification of problems, but I'm not seeing any of the other efforts that will lead to that. So. I'll open it up again to task force members, but I think I've said my part. So any other members of the task force like that?
This is Dagny. The only thing I'll push back on, Caleb, and I understand your frustration. You've made it very clear. I understand your point about the clause that Elko County included in their plan about the enforcement, but I do think still we have to give Elko County some credit and Amanda and her commissioners for all the hard work that they've done to try to address the testing issue. In looking for other contracts and making efforts there. And so I don't think that we should write off their plan completely. And I do think that they should get credit for a lot of the hard work that they've done out there.
Thank you, Dagny. And I want to be very clear. Commissioner Andriozzi, Matt, Amanda, others who've been engaged in this process from day one have been extremely helpful. And the plan that we see today is progress in all of those things. I don't know how this plan squares with the governor's call to action on Tuesday night that basically said, if we're not taking real measures here to address the outbreak and the spread in the communities, then we're going to have to do state level shutdowns. So that's my perspective. I appreciate you clarifying. I'm open to any solutions here. I want to be very serious and very clear about this. The state will take ownership of the state turnaround. That's not an excuse for any jurisdiction's inability to get control of an outbreak within their community. We'll provide support, we'll provide feedback, but if that outbreak gets beyond the control of that community, the state's going to have to take action. And I'm not seeing the seriousness that I think we need to see from Elko's plan here.
Director Page, is Lieutenant Colonel Compton. In reading through the action plan here, and obviously we've had the very serious discussion about enforcement and emphasis on that, would it be acceptable or advisable that we give them a shorter amount of time to revise the action plan, something that can then have some sort of an outcome within the governor's 2 weeks, and get to us at the state any resource requests they have that they haven't already identified in here? For instance, if they need help from Director Reynolds with OSHA compliance or things like that, so we can give them a fighting chance, but also give them a chance to take some ownership at their level.
The only problem I have with that, of course, is the turnaround time for public meetings. And so if we were to review it, we could review it, but we couldn't review it as a group really, because essentially we have to have the next meeting posted Wednesday. If we had a meeting agenda posted tomorrow, then Wednesday would be the first time. And Chris Lake, you are not muted. So do you have a motion, Colonel Constant, regarding any next steps that we should have? And I would just say, I don't know that we could use any shorter turnaround because of the open meeting law posting requirements.
I don't know if it's an appropriate motion, but it would probably be a motion along the lines of, I move that we accept everything except for the action plan and require that at the next task force meeting, Elko would come to the task force with a more robust enforcement plan.
I think that's an acceptable motion. Are you saying we should approve now or reject now?
I would move that we accept the plan up to the action plan and excluding the enforcement plan and require a more detailed enforcement plan.
Okay. We have a motion for consideration right now, and that is to approve the current plan with the expectation that next week's plan would have the enforcement actions built out a little more. Brett, does that reflect your motion?
That's correct.
Is there a second?
This is Richard. I second.
Thank you, Richard. Any discussion? Hearing none. All those in favor, please signify by saying aye.
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 Any opposed, vote no. Okay, motion passes. Thank you very much for your time on that. We have a couple of agenda items left. And this meeting has already gone 4 hours and 15 minutes. And I know that everybody has given up an awful lot of their day to make this happen. I appreciate you joining us today from the task force perspective and from our local partners perspective. And I know that it speaks to how important this is. We've heard an awful lot already on from the local health authorities, and I will. I'm just going to go ahead and move beyond or not open agenda items 7 and 8 and go to straight to public comment right now out of respect for everybody's time, so we don't have an all-day meeting here. I'm going to open up agenda item 9. No action may be taken upon a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action may be taken. Public comments will be limited to 2 minutes per person at the discretion of the chair, and comments will not be restricted based on viewpoint. So what I'd like to do right now is open up public comment. If you'd like to provide public comment, please press *6, and identify yourself and make public comment. We will be limiting public comment to 2 minutes. Is there public comment at this time? Again, because we're using a technical system here to call in, I want to ask one more time if there is public comment. If you are calling in by phone, please press *6 in order to provide public comment. Identify yourself and make your comment.
Hello?
Hi, go ahead.
Hello? Oh, hi. My name is Debbie DeValve. I'm in Las Vegas. I want to thank you, COVID Task Force. I have a few questions. How is the task force addressing the mental and physical impact of the social distancing, restricted breathing, and limited gatherings, such as statistics of cases of anxiety, depression, divorces, suicides, etc., also loss of home, loss of employment, etc.? My next question is when OSHA and business licensing departments are checking on business compliance, are they not holding it against businesses who serve customers who cannot wear a mask, which is allowed under Governor Directive 24? Also, I would like to recommend that experts in immunology or virology, etc., to offer input of how we can address COVID from the inside out rather than only from an external perspective. Among those lines, what is your plan to promote mental and internal health, such as consuming less sugar, healthy eating, taking vitamin C, D, zinc, etc., which have been proven to help? Also lowering fear and anxiety. And for my last comment, as you are government employees that have sworn an oath to uphold the U.S. Constitution and the Nevada Constitution, how are you planning to make sure that Nevada citizens keep their inalienable rights? And I quote Article 1, Section 1, all men are by nature free and equal and have certain inalienable rights, among which are those of enjoying and defending life and liberty. No directives by government officials can take away our inalienable rights. You are there to protect and uphold them. Make sure all our rights are protected in your plan. Thank you.
Thank you. Is there additional public comment at this time? Hearing no additional public comment, we'll go to agenda item number 10. Is there a motion to adjourn?
This is Richard. I make a motion to adjourn.
Thank you, Richard. Is there a second?
Chris Lake will second.
All right. All those in favor, please signify by saying aye.
Aye.
Meeting adjourned. Thank you, everyone.